to welcome you all to Perfection Fortisphere by ISAR Symposium 7.0. Kindly note that today's session provides a certificate of attendance, so we encourage you to stay with us throughout the program. Today's discussion focuses on an equally important and as yet under discussed area in reproductive medicine, and that is navigating ART and surrogacy laws in India. We look forward to an engaging, insightful discussion with our distinguished faculty and expert guests today. To set the tone, it's my pleasure to introduce our convener, Dr. Monica Singh Ma'am, a trailblazer in the field of reproductive medicine. Ma'am currently serves as the President-elect Bhopal Obstetric and Gynecological Society, founder president of ISOPA Bhopal chapter, national executive member ISAR. She is also the convener behind several
मेरा
impactful
कंप्यूटर
academic
लॉन्च
initiatives, including the ISAR Perfection Series, the Foxy Symbiosis Series, and the Synergy Academic Club. We welcome you, ma'am. Over to you.
Thank you. Thank you so much. And thank you everyone for bearing with me. I must be boring everyone to bits now, but it's a very special day for me because Nandita ma'am is again here. Like she is the person who started ISAR Perfection. I still remember that, day in March 2023 when Madam said you wanted to start something, some scientific symposium, to just start with ISAR. And then I got a go ahead from Nandita ma'am. I got a go ahead from Sunita Tendulwadkar ma'am, and we started with the series. So this is nearly going to complete now 3 years in 2026. So thank you so much. And without wasting time, we run you through the program. And Purva, can you please send the faculty link to Dr. Randhir Singh, Purva or Ankita, anyone,
Yes,
please?
ma'am. Yes, ma'am.
Yeah. So today's symposium is very special because we are talking about how to navigate ART and surrogacy laws in India. And a disclaimer that we've already dealt with this topic, but seeing the interest in this topic, the number of doubts people have, and the galaxy of experts we have all over India to solve these doubts, I thought let's get them all together and let's discuss the surrogacy rules as they are functioning today in the various states of India. I thoroughly thank with all my heart the ISAR dignitaries, Dr. Amit Patki sir, President ISAR, and Secretary General ISAR, Dr. Asha Bakshi ma'am, for giving us this privilege and honor to host this series. I would like to pay formal thanks and welcome to our dignitaries from ISAR. Anmol. So, Dr. Amit Patki is our president, and he is also a very, very hardcore academician. And because of him, we have started so many master classes and so many on-site and off-site meetings on various less talked about academic topics. He is a TEDx speaker, a great academician, and he loves meeting people and he loves encouraging youngsters. We thank you, Amit sir. And I think he's not joined us today, but Asha ma'am is there. Asha ma'am has led ISAR from the front. We know the amount of hard work she puts in every venture she undertakes. And whether it is Foxy or ISAR, she leads both the organizations with equal passion. A lot of love for youngsters. She's always, her favorite phrase is, Monica, sabko lena hai, Jyoti, sabko lena hai. So, I mean, this is the type of passion she has. She is in love with Madhya Pradesh and she wants to take the state forward, and we are doing a wonderful job under her guidance and leadership. Madam, being the pioneer of uh, IVF and ICSI in MP, we would like to have blessings from you before we start this program.
Thank you, Monica, for the kind introduction. And first of all, I'm really thankful to you and Randir for coming out with such bright ideas and such good, high quality webinars, which are really popular. And and I'm really thankful to Dr. Nandita Palshitkar, who is a, I would say, star, very well experienced, seasoned person in the field of reproductive medicine. And we are really honored to have her here as a chief guest. And the guest of honors, Dr. Charmila, Dr. Shivani, I really welcome you. And the special guest, Dr. Shweta Kaul Jha, who is from Indore only, and Monica from Alwar. So, warm welcome to both of you. And of course, Monica and Randir are really doing good job. But without the help of Garima, Manisha, Dr. Neelam, it would be not so effective. So thank you so much. And of course, the coordinators, Dr. Ankita, Dr. Payal, Dr. Purva. Thank you very much for all the effort and making it vibrant. So it becomes like a bouquet when all these people are there, and that really puts up the great show. And today we are really honored to have Dr. MC Patel with us, who is a very senior medical legal person, and he has advised so many gynecologists. And he is a man with golden heart and who always is ready to help everyone. Where whatever the problem is, you can discuss with him, and he really gives you a good advice. And we are again fortunate to have our own Jyoti, Dr. Jyoti Banglowala from Indore, who is a very hard worker and who has shown that how with the hard work really you can reach up to great heights. And she has specialized in medical legal medicine, and especially she has officially passed the law exam also. So and she's again a very helpful person. And anyone, at least I know from Indore, that anyone who needs help, she is there to go with them. She really helps them. So that's really nice, Jyoti. And it's nice to know that you are taking interest in the field of ART also. So whenever we have problems in ART, we are going to come back to you. So, and the panel discussions are always good, and you get such small points in your day-to-day practice that really helps you. And all of a sudden you remember, yes, that case was discussed and this was. So we will learn a lot from panel discussion also. So under the leadership of ISAR President Dr. Patki, ISAR is really doing very good academic work, and these webinars are showcase of his great vision. So with all that, I would like to welcome you all once more, and I look forward to hearing to Dr. Nandita Palshetkar. Thank you.
Thank you.
Thank you,
Thank
Basha
you.
Bakshi ma'am. Thank you.
Thank you, madam, for those words of wisdom. And now we welcome the star of the show, Dr. Nandita Palshetkar, ma'am, to ISAR Perfection 7.0. She is the person who initiated ISAR Perfection, and it's an absolute pleasure that as we enter into almost the 32nd month of this episode, madam is again with us, yet again with all her charm and her grace. And thank you, ma'am, for all the hospitality and love you've showered upon all of us every time we are in your vicinity. And madam, talking about you would be like lighting a candle in front of the sun. So without wasting time, I would just say that she has led all the organizations from the front in India. Let India be bestowed with lot of importance, not only in South Africa, US, UK, wherever she's put her foot, aspire. So, madam, the stage is all yours. This program is your baby, and under your guidance, it's blossomed. And we would love to have blessings from you, ma'am.
Thank you, Monica and Randhir. I think it's really a pleasure because when they approached me with this program, I thought it was wonderful the way they want to distribute the knowledge, see that the knowledge reaches everybody, and webinars are a beautiful way. Can you take off that my slide so that I can see everybody?
Anmol, please stop.
Yeah,
Yeah.
thank you. And they always say
Bluetooth not connected.
Ankita, please go mute. Yeah.
yes,
Yeah.
it happens once in a while. It's okay. The three B's of Madhya Pradesh. I think Bakshi, Baser, and Bapat. They've really brought Madhya Pradesh to the national forum, and it's been amazing. I think I've been Asha's friend for a long time, and the mutual respect that we have for each other, it's amazing. First of all, I want to thank Amit, for this continuation of the series. I think it's great, and Isar is doing great under him. And let me tell you, Asha, this couple, Monica and Randir are flying the Madhya Pradesh flag very, very high. Trust me, they are doing a lot of work, and I can see my other girls over here. Jyoti, I don't have my glasses today, so Jyoti and Shweta are here, and I think having seen them work so hard, it's amazing. And all my IVF friends, I can see Shivani. Shivani, how are you? That's really great to see all of you. And Dr. MC Patel, I think that's fantastic. And this little girl from the south, Charmila, I call her a little girl, but she's no longer a little girl. But definitely doing a lot of good work. And it's so good to see everyone, doing fabulous work in this field. I think Manisha is there, Vinita is there, Purva, and a lot of other people. But remember one thing, this law which has come in, I think, somebody asked me a question on the podcast, Madam, do you think we are now on par with the West? So I said, yes, technology wise, whatever they have, we get into our country and we are really up there with them. But regulation is something that we have just got it in. And believe me, regulation will bring in ethics, will bring in quality of work. And I think that is what the whole aim of that regulation was. And I'm glad today that you are discussing the regulation and, of course, surrogacy, because there are a lot of women who need it. And I think it's the need of the hour. And it's a very, very sensitive topic. Oh, sorry.
That's
Sorry, guys. Sorry. Gee. So it's a very, very sensitive topic, and it needs to be, really tackled and heard and discussed. So I'm really happy. Thank you, Monica, for inviting me here. Oh my God, this is like mera sab ijjat ka falooda. So thank you.
No,
Adding to
madam,
your
we are liking
grace,
Nandita,
Nandita.
madam. We are
You're
liking
very
her, madam.
happy.
We wanted to
You're
see her.
very happy to see this.
Yeah, ma'am.
Anyway, thank you so much for inviting me, and it's really a
नहीं इज्जत का फालूदा नहीं कह रही थी तू शांत रह
me
She
to
was
hold her. She's going to
Happy to see.
अभी पकड़ लिया anyway. Okay, chalo, thank you so much, and it was a real pleasure. It was a
Thank
sorry
you,
for
ma'am.
this. Ouch.
And we love Zuri and Nani together. Zuri and Nani together.
I don't want to waste more time on this, but really all the best, and please enjoy this knowledge seminar. I think these two guys have worked very hard, and they really give you the best of knowledge. So thank you so much. I love Madhya Pradesh, and it's good to see Dr. Patel over here. Hi, MC. So good to see you, and I'm sure they're going to benefit from your pearls of wisdom. Thank you very much.
Thank you, Nandita, ma'am, for
Thank
giving
you
her
for
permission
inviting
three
us.
years back for this initiation. Thank you, ma'am.
Thank you,
Thank you
ma'am.
so much, ma'am. Thank you so much, ma'am. So, after Nandita ma'am's blessings, it is time to move on to guests of honor. And already we can see our guests of honor here lighting up the screen. I have my mentor, Charmila ma'am. Ma'am, namaskar. And I have my very, very sweet friend from Delhi, Shivani Kaur. So I will introduce them one by one and they can speak to us and about this program, about the vision about this program. Charmila ma'am, as I know her, she is one of the trailblazers of Foxy. I've seen her walking step by step, and at the same time, whenever she's forging ahead, she never loses the base, the foundation. She always has that extra minute to talk to you. I remember Charmila ma'am, after I lost my Foxy election, Charmila ma'am talked to me for I think 45 minutes. So, Madam, I'm blessed to have a mentor like you. Madam has led the South Zone of Foxy. She has been very active in the clinical research committee that speaks volume of the amount of academics she puts into ICOG and the lot of programs she does with Foxy, like the Medha, the Gurukul program. Her knowledge about obstetrics is phenomenal. She has visited even the smallest societies and spread her pearls of wisdom. She is active in the WHO Southeast Asia region of MDSR. She has tutored a lot of girls, youngsters, adolescent gynecology is her forte. And she is very active in the Gestosis India Association. And she's also a managing committee member of the PCOS Society. Madam, there's hardly any topic you cannot speak on. I know that, ma'am. So we would just like to have your blessings before we embark upon this program.
Thank you, Monica. It's always a pleasure to be in a program where you have arranged, because I know there'll be lots of knowledge sharing there. And I've attended many of your programs, and it has always been a learning experience, I would say. And I'm very happy to be in a program where Asha Bakshi Madam is a dignitary, as well as the chief guest, Dr. Nandita Madam, as you said, is one of the sweetest persons whom we have in Foxy, and always helps us in whatever work we have. And Dr. Shivani, I've known her through Foxy only, but I would say she's another sweet person always. And it's always a pleasure to see you, Shivani, wherever
Thank
we
you.
meet. Yeah.
Yes.
And the special guest, Dr. Shweta and Dr. Monica Gupta, great friends always. And the co-conveners, Dr. Garima, Dr. Manisha, and Dr. Neelam Bishe, and the coordinators, Dr. Ankita, Dr. Payal, and Dr. Purva, and great speakers. MC sir is always has helped us so many times whenever we had a medical legal issue. And as he says, you should have a visiting card near you always. In any emergency, you call him, and sir is available always. And the other talk will be by Jyoti Mai. I would always call him a AI twin, because we have always been mistaken in every conference for each other. And Jyoti is also done such great work in her committee. And I think she has created lots of uh, I would say ripples there also, because so many things have been changed after Jyoti has taken over in the committee. And a great panel which will be moderated by Monica and Dr. Randir, and experts Dr. Aji Patel and Dr. Dharmesh Kapadia, and a big group of panelists from throughout the country. And I'm very eager to listen to this talk, because surrogacy has fallen into disrepute in many of the places, because we do not have a knowledge of actually how the law works. So it will be I think it will be a learning experience for all of us to listen to this, and probably get back into the surrogacy programs again, because many of us have stopped doing a surrogacy because of the uh, perceived problems which we cannot comprehend many of the times. So I think we learned so much from this program. Thank you, Dr. Monica, for inviting me, and all the best for whatever you wish in life. And we are there for you. All the best.
Thank you, ma'am. Thank you, Charmila, ma'am.
Yeah, thank you, Dr. Randeep.
Blessed to
Thank
have
you.
your presence, ma'am. Thank you so much, madam. And we would love if you could listen to our speakers. And ma'am, in case you miss it, this program will be recorded on YouTube, and I will be forwarding the link to you. With your permission, ma'am, I'll move on. And it's my great pleasure to invite and welcome Dr. Shivani Sachdev Kaur. We call her lovingly Shivi. And wherever Shivi, I mean, when you walk into the room, it lights up. You don't need any electricity lights. So, I mean, you are that sort of a person. Not only are you physically very beautiful, but you are very beautiful inside out, that I have seen. You have started surrogacy in India very ethically, and you did it with a passion at a time when law and regulation were not there. But we saw the way you forged ahead, the type of work you put in, the type of hard work, and you still connect with your patients. And we see those lovely children walk into your clinic with all the, flowers and the gifts you give the children. It's always a pleasure to see you work. And you are one person who teaches everyone that gynecologists can be a fun loving person also, besides Shweta. Shweta is another person who tells us that. So, Shibi, the stage is all yours. Kindly give your thoughts about the program.
Thank you very much, dear Monica. An introduction which only you can give because you have your unique style. And I would like to first of all give my respects to Dr. Asha Bakshi and Dr. Amit Patki sir. Under their leadership, ISAR has risen to even greater heights, and we would like to congratulate them and also thank them for supporting us even in our Delhi state ISAR programs. Dr. Nandita, ma'am, she was the one who started this webinar series. And when you have a five-star, like a superstar icon of India like that, of course, your web series is going to be a huge hit. And Monica, I remember when you and Randeep started this series, I was one of your first speakers in one of your first series, especially when the ART law had come. And Randhir, you remember 2012-13 when the surrogacy law had started, rumbles, the earthquake tremors had started, and you had come to Delhi, and we had so many programs at that time. So we are deep into this for so many years. And really, his message is, your message is unity. Always I remember Randhir with his hand, unity. So to stay united, you can achieve anything. So that is the best message, really, I feel that we can give. Dr. Charmila, my honor. I admire you so much. Your picture comes on WhatsApp and I light up. So really, Dr. Deepak Bhagre is here. Such a wonderful mentor. I mean, you have to be blessed in life to have met people like Dr. Deepak Bhagre, really. Then Dr. Manisha Vajpayee is here, Dr. Purva, Vinita ma'am, Ankita is here, and we have Dr. Jyoti, the sweetest and the kindest person, and of course we have great mentors like Dr. Rajnikant Patel, and you have himself, Dr. R.G. Patel, sir, here with you, Dr. Mosmi, Dr. Manisha, who I know so well from Facebook. So many people I see here and see them from Facebook. So it is a great honor for me to be here. And today I have taken over 3 sessions. So I've just given a talk to Noida Society, now this, and then I have another talk in a webinar in between patients. So, but when Monica called, I have to be here. And the topics are so interesting. I'm going to be here with you. So thank you, everybody. Thank you.
Thank you. Thank you,
Thank you,
Shiva.
Dr. Shivani. Yes, we were together from the day one. That is from seed of this webinar. Thank you.
Thank you, Shivani, for always being there. And we would love to have you as a speaker very shortly. So enjoy the program. And I would like to now introduce special guests. So I got a query from my friend Monica Gupta that what do you mean by a special guest? So we don't see special guests in webinars. So how come there is a special guest in perfection? I said a special guest is a special person. Sometimes there's a person who cannot fit into a chief guest or a guest of honor, but that person requires some sort of special treatment. So, a special guest is our guest of the series who has done something very benefiting to the organization, or who herself or himself is a spark who inspires others. So, our special guests for today are Dr. Shweta Kaul Jha, Managing Committee Member ISAR, as well as the newly elected Chairperson of Medical Technology Committee of FOXI. She actually embodies both these organizations thoroughly. We also have Monica Gupta, who, as a special guest, who is a senior gynecologist from Alwar. She is leading the public awareness committee from the front and is a very active coordinator of multiple web series going on all over India. She's also the West Zone coordinator of the PSC committee. So I would like to formally introduce Shweta. Shweta Kaul Jha from Indore has taken Indore one step ahead in its academic and organizational brilliance. Congratulations, Shweta. Not only does Shweta lead in the MP ISAR front, but she's also very, very active in the national ISAR. She got contested the managing committee elections of ISAR. She got elected as the managing committee member. But she didn't stop there. She went on to conquer the Foxy chairperson election, brilliantly so, and she got a committee which is very befitting to her age and stature. That is the Medical Technology Committee, because we see from her work how much high tech her work is, how much enthused she is with new technology. So, congratulations, Shweta, for whatever you have done for Indore and for our state, and as well as ISAR at the national level. And we would love to have a few words from you.
Thank you, Monica Madam, for the kind words and for the kind invite. I'm so thrilled to be here. among the galaxy of stars. I'm almost speechless. And the description you gave of special person, I think so only you could have given that. I mean, it was very kind and very nicely put, and it makes us feel really very special. And I would like to thank Dr. Patki and Dr. Bakshi, under whose leadership and in their tenure I got to contest and win this election. And for Nandita ma'am, what should I say? She is a mentor to you, and she has, mentored all of us. And she has been so kind to me as well. For my committee also, she gave me so many suggestions and she guided, and literally her support was there for everything. And even for Charmila ma'am. I mean, when there are no words to describe how kind and helpful all of them had been in my journey with Isar as well as Foxy. Then Shivani is a dear sweetheart and a queen of surrogacy. We all know her. And Monica, ma'am, as you have put, has worked so hard with the web series. Garima, Manisha, and Neelam have been managing committee members with me. And Young Brigade from Bhopal, Ankita, Payal, and Purva. I wish them all the best. And I'm so delighted that today we have Dr. M.C. Patel and Dr. Jyoti Banglowala to give the lecture, and along with the panel moderated by the star couple, Dr. Randhir sir and Dr. Monica ma'am. In the end, I would like to just thank you, Monica ma'am, for having me here. And both of you are an inspiration for all of us. I mean, I think so. Like I came early, you might come late, but all of us deserve to be there. And I wish you all the best for your future endeavors. Thank you, madam.
Thank you.
Thank you, Dr. Shweta. Thank you for nice words. And uh, to inform all the audience here that the father of Dr. Shweta Kaul Jha, Dr. Jha sir from Dr. Gwalior, he's a very beautiful person and he's very beautiful from the heart. And you have taken all the genes from him. Thank you. Thank you.
Thank you, sir. Thank you, sir.
Also, Ratna ma'am, Shweta has got
Blessed genes.
blessed genes. Ratna Kaul ma'am, the luminary gynecologist from Madhya Pradesh, as well as a father who is so kind-hearted and famous. So, Shweta, you are blessed.
Thank you.
And I think you have to carry the legacy forward for a long, long time.
Thank you.
Now, is Dr. Monica Gupta there in the program? Purva? I think since she has not joined till now, I think I'll just move ahead and hand over the session now to Dr. Manisha Bajpai. Before I hand over, I would like to pay my thanks and regards to Dr. M.C. Patel sir and my senior Dr. Jyoti Banglowala madam for accepting our invitation and delivering, really great lectures today, which many, many hundreds of people will be attending today. Thank you so much. Manisha, I would like to introduce. I'm sorry for the for the carelessness, but Manisha is such a regular in this program that sometimes I forget to introduce her. I feel that everybody knows her, but she is a person to be introduced because she is there when nobody is there. So this particular episode, Garima and Neelam were busy with their personal programs, and Manisha stepped in and she said, Monica Di, don't worry, I'm there. And she's always there. So, Manisha, I look up to you because you are a figure who has really worked hard in embryology. And we can see the quality of work you put in ISAR as well as ACE in your webinars, in your physical conferences, and along with that great, friendship with all genre of embryologists and clinicians which you maintain, and you have a gift of friendship which very few people have. So
Thank
thank
you,
you,
ma'am.
Manisha. I would
Learning a
like you to
lot.
take the program forward.
Thank you so much, ma'am, for your kind words. And it's privilege being here in amongst the galaxy of stalwarts and star. I feel really special being here. So, and now it's again my privilege to introduce the people behind this series. And today it is special because Nandita ma'am is also there. It is a brainchild of all three, as we all know, Dr. Nandita ma'am and Dr. Monica ma'am and Randhir sir. So it is my privilege to introduce the convener of this series, Dr. Monica Singh and Dr. Randhir Singh sir. This academic series is their brainchild under their scientific vision. We are continuing to conduct the 7th session of this series today. Dr. Monica Singh, ma'am, can I have her CV, please? A brief. She is a consultant reproductive medicine and endoscopist at Bhopal Fertility Endoscopy Maternity Center and ART Bag.
Manisha,
No,
you can
ma'am, a
skip
brief
it.
introduction because earlier even. So, ma'am is professor in Obs Gynae department at Allen Medical College, Bhopal. She is president-elect of Bhopal Obs Gynae Society and founder president of ISO Parab Bhopal chapter. She is a national executive member of ISAR, joint treasurer of MP AIG, and coordinator of Foxy Infertility Committee 24-27. She also served as a
We are
founder.
wasting time. Manisha, we are wasting time.
Okay.
Please go ahead.
So
I'm
it's
embarrassed, you know.
oh, ma'am, please. So we all know that this series, and she is a very known name in our field, and her presence has strengthened the reproductive medicine not only in MP but beyond. And our second convener, Dr. Radhir Singh, sir, again, he doesn't need any introduction, but just to brief, he is an ASHRAE certified embryologist. We are so proud of this, and a very well-known name in ART fraternity. He fondly remembered as organizing chairperson of ISAR National Conference 2023 and ISAR Embryology, I believe 2018, both conducted with exceptional precision, discipline, and trademark personal involvement that makes his event uniquely successful. At present, Sir is Director and Head of Embryology at Bhopal Fertility Endoscopy Surrogacy Clinic Center and ART Bank, a gold medalist, a national academic leader.
Dr. Manisha will continue. Yeah, please, because I
Sir,
mean,
please
we
let
have
me
a talk.
brief a little.
Yeah, we have a moderator also. Yeah, that's good. Thank you. Thanks for nice words.
Okay.
But I'll say few words for Manisha, Doctor, for everyone. She's always, Monica says, she's always everywhere.
Sir,
जहाँ आपको कोई जरूरत पड़े वहाँ Manisha is always
sir,
there.
I'm
So,
privileged
and
learning
I
from you.
appreciate you and I salute you.
Thank you. Thank you so much, sir. So with this, I would like to brief a bit about my co-conveners who are not here today, but we are remembering them. Dr. Garima Sharma, she is medical director, Eva Care Fertility Mumbai, ISAR Managing Committee member, and Dr. Neelam Bise, Scientific Director, ACME Hospital Mumbai, and again ISAR Managing Committee member. Just a brief about our wonderful team of coordinators. May I have their CVs, please? Our coordinators team has been the operational backbone of today's program. May I have their CV? Ensuring scientific alignment, faculty communication, slide flow, technical execution with discipline and timeliness. So it's my pleasure to introduce our coordinator, Dr. Ankita Upadhyay. May I have the CV of Dr. Ankita? Yeah. So Dr. Ankita Upadhyay is assistant professor at Chirayu Medical College. She has been recognized with multiple national awards for her scientific presentation, including the Bursary Award and first prize in the oral papers at prestigious conferences. She is overseeing scientific flows, session structuring, and faculty communication seamlessly. Now, the second convener, Dr. Purva Badkur, she is assistant professor at Gandhi Medical College. She is a recipient of AMPOGS Yuva Oration Award 2024 and has authored over 20 research papers reflecting her strong academic leadership presence, handling documentation, coordination, and academic structuring with precision. Now it's my pleasure to introduce Dr. Payal Raghuvanshi, consultant Nova IVF Bhopal. She is known for her clinical excellence, being double gold medalist both MBBS and MS, and she brings a strong foundation in reproductive medicine to the team, recognized for her smooth execution of technical session, managing technical flow presentations, and session execution flawlessly. We sincerely acknowledge their contribution for making this program streamlined and professionally organized. With this, I would like to introduce today's scientific session 1. Today's session focuses on a subject of immense importance in reproductive medicine, medico-legal compliance in ART practice. As ART practice becomes increasingly regulated and ethically announced, understanding the legal framework is essential for safe, compliant, and responsible clinical practice. Today's expert panel will provide updated, practical, and policy-based insight And it's my pleasure to invite, without much ado, to invite our respected chairpersons for the session. So it's my privilege to introduce and invite Dr. Deepak Bhagade sir. Sir is a senior gynecologist and immediate past president of SOGS, an MD, gold medalist, former head of department OBGY at MP Shah Medical College, Jamnagar, and former president of both Jamnagar Gynae Society and Jamnagar IMA, scientific committee chairman of Gujarat State Gynae. He has delivered more than 5,800 babies in private practice, a truly remarkable clinical legacy. We welcome you, sir. Again, it's my privilege and pleasure to introduce and welcome Dr. Mausami D. Banerjee, ma'am. Our next chairperson, she is very well respected consultant obstetrician and gynecologist from Kolkata. She is past president of Bengal Obs Gynae Society 23-24 and a former vice president of IMA Calcutta. She has led major national conferences including BogsCon, Indogyne, Phytovision, BimaCon, and FWCon, and was a part of organizing committee of Grand AICOG 2007. She has delivered several prestigious orations and contributed extensively to the research and FOXY publication. We are fortunate to have you with us, ma'am. We welcome you. And it's a proud privilege to introduce Dr. Rajnikant Contractor, sir, with us. Sir is one of the India's foremost medico-legal expert in ART and PCPNDT. We all know him very well. He has served the Government of India as member, Central Supervisory Board, PCPNDT, member, NIMC, chairperson, National ART Bill, PCPNDT Committee, member, Advisory Committee, MTP Act, and he has been honored with multiple national recognition, including FOXY Late Professor D.S. Kutty Award. His expertise in ART regulation and medico-legal compliances is widely respected across the country. So with this, I'll request our esteemed chairperson to kindly take over the proceedings. Over to you, sirs and ma'am. We are privileged to have you with us today.
Hi, thank you very much, everyone. I suppose Rajnikant is also there. Rajnikant, would you like to introduce MC Patel? But before that, what a pleasure to be amongst friends here. Monica and Randir, thank you for bringing me here. Manisha, thanks for the kind introduction. The only amendment I would put is the delivery is 68,000 and not 6,800. Anyway, that is because that is the way I love, like Chamila, an obstetrician. I would really like to be called an obstetrician. But with most of my friends here, and to Monica, how do I say no to being a chairperson here? And when my friend, my classmate, my batchmate, MC Patel is giving a talk, what a pleasure to be chairing his session. How do I forget the other present also? I mean, I'm not naming you all, but I love you all, and it's always a pleasure to be here. Sweta, Jyoti, Asha probably has left. MC Patel, welcome, and I'm sure we are looking forward to your theme. RJ Patel probably has joined us. RJ, good evening. Hi. So, Rajnikant, are you introducing MC Patel or do I introduce?
Okay. Hello.
Hello.
Good evening, everyone. Thanks to Dr. Monica and Dr. Ranbir and all my dearest sister. What I mean to say that I'm a little bit busy in the social functions. I will leave at any time. Right. I introduced the Dr. MC Patel, sir. Right. Dr. MC Patel is a very well-known figure. So far, the medical legal issue is concerned. He's a medical legal consultant. He's a past VP FOXY. He's also the AICOG convener. He's also the president of the National Medical Council in NAMO, right? And he's in the renowned figure in the so far the medical legal issue is concerned. So I should not waste the time about the MC Patel, sir. So you all, Dr. MC Patel, sir, you should carry on.
Before MC Patel takes over, I would just like to. Before Doctor, am I muted?
It's a great pleasure.
Oh, yes.
Yes, Deepak sir, you're audible. Continue,
Okay.
Deepak sir.
Okay. Sorry. I mean, see, MC Patel, before he takes over, I would just like to say that what a legible, what a person he is. You know, being always a helpful person. And again, he is being contesting for the post of president. I suppose we all should support him in this endeavor of him. And I hope, Shivani, you are there. You are a lovely, lovely, lovely friend. And I really don't know what the feelings are when we meet each other. But I would always say it has always been a pleasure to meet you. Before anyone says, I think somebody else or MC Patel takes over.
Sir, Deepak sir, I think we are very fortunate that Deepak sir, you and MC Patel sir are batchmate. So I think you're the best person to know him from the everything from the heart. And just I'll comment, sir, Deepak sir, you're the person, the key man who is the Foxy friends who have made a Foxy 40,000, 50,000 a family member. Salute to you, sir.
It's a pleasure for all of us, but we are all friends, and it's really good to be all with all of you. Thank you very much.
Thank you. Thank you for your blessings, Bagre sir. And Mosmi ma'am wanted to speak a few words. Madam, please.
Yes, very good evening. It's my proud privilege to be a part of this ISA Scientific Symposium, and I must thank Amit Patke sir and Asha Bakshi ma'am and all the conveners, the co-conveners, and especially Dr. Monica ma'am to invite me to be the part of the program. And Dr. Sharmila, I have seen her. I mean, we have met so many times. All our friends are here, and it's a galaxy of eminent faculties. And Dr. Jyoti, obviously, and the best part of it is I'm chairing a session of Dr. MC Patel, and actually he has inspired me in this medical legal aspect, and he is very, very helpful. I am really grateful to you, sir, and he is a wonderful speaker, and just waiting to hear him.
Thank you for joining, Mosmi ma'am. It is such a pleasure to meet you always.
Thank you. Thank you.
MC sir, the stage is all yours.
Okay. Yeah. Let me share my screen. Is it seen?
Yeah,
it is loading, sir. It's uploading, sir. Yeah, seen, sir. Yes, MC sir.
Yes.
You can continue. Yes, sir.
So is it full screen?
Now full screen. Yes.
Yes. So greetings from Statue of Unity, tallest statue of world, and we all are proud of that statue. Warm welcome all the delegates and wishing you a litigation-free practice. At the outset, I would like to thank Monica and Randir in particular for inviting me to share my views about the subject. And I also thank all the chairpersons who introduced me in a nice way, Dr. Deepak, Dr. Rajni, and of course, Dr. Mosmi. And I also thank you all because you stood with me like a rock during my election campaign last year, though I lost. But I believe in this. It was nicely written by Shraddha Atal Bihari Vajpayee. Sorry. So he has very nicely written, क्या हार में क्या जीत में किंचित नहीं भयभीत में कर्तव्य के पथ पर जो भी मिला ये भी सही वो भी सही. So loss is not the end but the new beginning. Sorry. So journey to Sub Foxy continued with renewed patience, and my commitment is still there. Wherever you are, I'll be there. Promise to reach the unreached. And I'll be seeking the same blessing, same support, same help, same guidance next year in 2026 for the same post, President Foxy. So please endorse my candidature and please vote in my favor. So from clinic to courtroom, we have to discuss as far as this assisted reproductive technology is concerned. So usually I start any of my talk with this question: is it worth discussing? Yes. If it is yes, then why? because medical litigations are increasing in number constantly and steadily, and unluckily, we gynecologists rank first. And ignorance of law is no excuse, because as soon as any law, any act, any ordinance passes in government gazette, it is presumed by law that each and every citizen of India knows that law. So ignorance of law can never be an excuse. Let us see case. All these cases which we are going to discuss are real happened case and decided in different courts. So in this very case, it was misleading advertisement in camp, no result, no money. So one patient had been to this hospital, she was investigated and treatment was given, and rupees 90,000 were collected. Later on, they told that endometrium is not good, so embryo transfer is not possible in this cycle. So better we cancel this cycle. So cycle was cancelled. After deducting expense, center was ready to pay balance amount. So uh, center told that we incur some expense as far as some injection and some medicines are there, and so we will deduct that expense, and rest of the balance amount we will give back. But patient was not ready. Patient was interested to get total amount back, and case was filed. So inference held by the court and judgment was, though the center must have incurred cost in stimulation and pickup, but since it was promised, it has to be written in toto. So many a time this question come, money back if cycle fails. If first cycle fails, second cycle will be free. Can one give guarantee like this? Many a time question comes. Is it ethical? One more area, is it legal? And one more area, as far as NMC guidelines are concerned, can they suspend license merely on this ground of guarantee? So, as far as this part is concerned, in this particular case, they have give guarantee to give money back if cycle fails. They had not given any guarantee of result. And as per NMC guideline, you cannot give guarantee of result. You can give guarantee of best of your efforts, but not guarantee of result. And with one of our professional colleague in Mumbai, he had given guarantee of result in IVF treatment, and he had given guarantee that with my treatment 100% you will get baby, and almost 2 or 3 cycles were failed, and patient assured, and he filed a complaint in NMC. So NMC suspended license of that our gynecologist from Mumbai for 3 years merely on this ground of guarantee of result. So you cannot give guarantee of result. But as far as money back is concerned, I don't think anything wrong in that, because they are not giving guarantee of result, but they are giving guarantee if there is no result, we will give money back. And if they give money back, it's fine. But if they do not give money back, or just like in this case, they try to deduct amount which incurred for stimulation and some medicine, etc., it is not permitted. Once you have given guarantee to give money back, you have to give back. If first cycle fails, second cycle will be free. This type of guarantee can also be given. There is no issue as far as legal ground is concerned, because this cannot be the ground for legal battle if at all something goes wrong. So they can give the guarantee. But on ethical part, if we go on ethical part, so as per guideline from NMC, we cannot give guarantee of result. We can give guarantee of best of our efforts, and we have to practice that way. Let us see one more case. In this particular case, ICSI with sperm derived from testicular biopsy for a couple with male factor, that is azoospermia, and female factor, that is PCOS, and multiple fibroids. So ICSI was done in this particular case, and ultimately they succeeded in third cycle. So Progineva and natural progesterone prescribed for support. And this patient developed pulmonary embolism during course of this pregnancy. And they allege that total bed rest was advised by doctor, and it led to thromboembolic phenomena and ultimately pulmonary embolism. It was totally denied by doctor in court of law. Doctor told, I never advised complete bed rest. So it was denied. And in this particular case also, case was decided in favor of doctor. But there are some issues in this type of cases. ART done and donor gametes used. Is it adultery? Many a time on this ground, couple may ask for divorce. And many a time this question is asked. If ART is done and donor gametes are used, is it adultery? As such, no. If consent from partner, that is, if consent of spouse is taken, then it is not adultery in eye of law, and there cannot be ground for divorce. Artificial insemination with donor without husband's consent, can it be ground for divorce or judicial separation? Because these are issues which may have to face in few of the cases, because we have to give certificate that we had treated that very patient with AID. So in this type of situation, many a time questions come, can it be ground for divorce or judicial separation? Yes, because you cannot uh, go with artificial insemination with donor without husband's consent. And if patient has gone with this treatment without husband consent, and if you have entertained this patient in this, then it becomes a ground for litigation against you also. So never entertain ARD treatment without consent of husband. And and in this type of situation, it becomes a ground for divorce also. Artificial insemination with husband, pregnancy, husband never had intercourse willfully or because of impotency. In this particular case, it artificial insemination with husband was done, but sample was collected by biopsy only. And in this particular case, husband had never intercourse willfully or due to impotency. Now question, is it considered as a consummation of marriage? Can decree of nullity be granted in favor of wife for divorce under impotency? So very interesting situation in this type of situation. It is not consummation of marriage because they had never an intercourse, and whatever treatment given, of course from husband semen, but it was from other means, so there was no intercourse, and it was proved case of impotency on part of husband, and it was declared that it is not consummation of marriage. Decree of nullity is possible because there was no intercourse between both this couple. Death of husband during early pregnancy. One more situation. Death of husband during early pregnancy. Now question raised about legitimacy of child. Many a time this type of situation may occur. With IVF treatment, patient is pregnant, and in very early pregnancy, death of husband. And many a time this question come, is their child legitimate? Indian Evidence Act clearly speaks that child born with 280 days of dissolution of marriage, death or divorce is considered a legitimate child. But if it was from stored sperm of husband, then this doesn't hold true. So we should be careful if at all we are called in court of law to give our opinion about this. So if child is born with 280 days of dissolution of marriage, then this child will be considered legitimate. Legitimate. So death of husband during early pregnancy, question raised about this is we have discussed. Sorry. What happens if DNA of baby doesn't match with indenting parents? In other words, if it was lab mix up, what happens in this type of situation? The DNA of surrogate baby doesn't match with genetic or indenting parents, is the indented parent still bound to take custody of baby or babies? Many times this type of situation may occur. If it is mixed match on a part of lab, and if sample is changed, so uh, question comes, in this situation also, intending couple is forced to take custody of baby or babies, because in very recent past, same type of case happened in city of Delhi only. So after delivery, custody was given to intending couple, and in due course, a patient came to know that this child, as far as these childs are concerned, her husband is not genetic father of those child. Case was filed, and case is decided in favor of patient. So we should be very careful not to end up into this type of mismatch sample. Death of an egg donor. What is the medical legal scenario? Many times uh, this type of situation may occur, and question comes, what is the role of ART bank in such situation? So as far as screening and selection of donor is concerned, it is totally a responsibility of ART bank. So patient should be properly screened, and selection of donor should be as per criteria of ART Act. I do not go into detail because next speaker is going to talk about that. So we should be very careful at the time of selection of donor, and all the medical tests we should go for, whether she is fit to go for ovum donor program. Let us see one more interesting situation. Is it legally correct if wife without husband's knowledge request for egg donation? No. In this situation, consent of husband is very much must. Is it legally correct to use donor sperm with only husband's consent without wife knowledge, or vice versa? Again, no. Because in this situation also, both the partner involved in ART program should be taken into consideration, and consent of both the partners should be taken. As far as consent in ART Act is concerned, it is very clearly mentioned that all the party involved in ART program should give consent. If it is donor program, then donor has also to sign document. If it is sperm donor, sperm has to give consent, and same way intending couple has also to give consent. So consent is must of all the party involved in ART program. One more interesting situation: embryo develop, but before transfer, death of husband. Now, can wife use this embryo in future for herself as far as ART program is concerned? Same way, if death of wife, can husband use in her girlfriend or her second wife the same embryo which are already preserved with ART clinic? Or in event of death of both, embryos develop, but before transfer, death of both, can father of husband claim embryo, saying that it is inheritance of my son, and I am eligible to get custody of that embryo and to go for a baby with a donor surrogate or so? Can be this done? Same way, can father of wife claim embryo in this type of situation? So in all these question, very clear thing is there. At the time of taking consent with intending couple, we have to be very clear in event of this type of situation what we should do with embryo. If they have given consent that in event of death of husband, wife can use embryo, then we can use embryo in that very patient. No issue. Same way, if wife has given consent to give embryo to her husband, then we can give embryo to husband also. But in death of both, this is very tricky situation. Whether embryo can be given to father of husband or father of wife. So in this situation, if they have not given consent like this, then we cannot give embryo to anybody. Second option is we have to allow those embryo to perish, or if they have already given consent, then embryo can be given for research purposes also. But in any of this situation, prior consent from intending couple is very much must. Let us see one more interesting case. In this case also, married for 12 years, no kid, an advertisement by one of the fertility center they read, and they went to that clinic. Childless couple approached that fertility center, suggested to have child through surrogacy. Actually, they had been to that very clinic for ART treatment to have issue, but they suggested that you are poor candidate for ART program, and we will have to go for surrogacy program, and you will have child of your own as far as biological parenthood is concerned. So couple was ready, and they paid rupees 15 lakhs as they had a contract, and they went with this program further. But surrogate mother was not at all shown to this couple. They had no meeting with surrogate ever. They were not knowing with which surrogate or with which person this program is being carried out. So they were told that surrogate mother will give birth maybe in August 2020. So they were mentally prepared that they will have baby in month of August. However, in July 2020, two doctors were arrested by Vizag City Police along with 6 other on child trafficking. Because in this was big scandal. They were telling couple that we are going for surrogacy program, but as such, it was trafficking of child, and they were giving child to that very couple. These were the scam going on with this. But in this particular case, it was raid, and both the doctors were arrested. They were released on bail. So couple approached them and they asked for money back. So 15 lakhs was given for this program. So they were asking money back. They kept giving all kinds of excuses, but fertility center didn't give money back. So this couple preferred a notice. They filed a case against this doctor, and in this very case, court was very clear, and judgment was in favor of patient, and judgment was to return rupees 15 lakhs and compensation of rupees 1 lakhs and legal expense also to be paid to that very couple. So with this type of cases, very clear cut carry home is never involved in this type of illegal activity. As far as ART treatment is concerned, we have to practice ethically and in provision of ART law only. Let us see one more situation. Can an egg donor bank supply egg donor to clinics located in different state? Yes, it is allowed. Can woman unrelated to commissioning couple be a surrogate mother? Now with amendment, it is yes. Now anybody can be a surrogate mother who is willing to offer their volunteers to be surrogate. But there should not be any commercial transaction. It should be totally free of cost. Can an unmarried woman donate egg? Yes, if she is fit by age and other criteria as far as her medical fitness is concerned, then unmarried woman can also donate egg. Can an unmarried man donate sperm? Yes, he can donate. If he fits in criteria as per ART law about her age and fitness. Can an egg donor bank be run by an educational or charitable trust? Of course, yes. Anybody can run ART bank, ART clinic, surrogacy clinic, but persons working in those very centers should be qualified, and there should be affidavit from them that they are working in that very center. In ART bank, if it is run by educational or charitable trust, but if qualified person is working, then ART this authority can give permission to charitable trust or educational trust also to run ART bank. Can an egg donor supply frozen eggs to clinic? No. It is only prerogative of ART clinic. Can egg donor bank stimulate egg donor and conduct egg retrieval process? Again, no. This process can only be done in ART clinic, which is registered under ART Act. Can egg donor bank advertise for recruiting egg donors? Here, controversy. So few people are saying that they can, and few people are saying that they cannot advertise for this. But according to interpretation of law, they can give advertisement, and if any volunteers fits in criteria of donor, then they can be entertained as a donor. Can an egg donor bank collect semen sample from level 1 and level 2 clinics? Yes, they can collect sample from level 1 or level 2 clinic, and ART bank has power to collect this type of sample from qualified donor. Qualified donor means he should fulfill all the criteria as per provision of ART Act. Can egg donor bank supply stimulated donor to level 2 clinic? No. Again, stimulation will be done by ART clinic only, either level 1 or level 2, whichever they are practicing IUI or in level 2, all the procedure. But only ART clinic will go for stimulation and further treatment. Many a time, this is the scenario. IVF consultant sell gonadotropin for profit margin. So, is it allowed? Can they sell their medicine to their patient? So, under pretext that I am using for my patient, if you are using medicine for your patient only, then it is not selling, but it is dispensing. You can dispense medicine to your patient only, but you cannot sell medicine to patient whom medicine is prescribed by another person. And if at all you want to practice like this, then you have to get license from drug department. So very important issue, use versus sale of drugs, and under DGCI, it is very clearly mentioned by DGCI recommendation also, doctors can legally dispense medicine to their own patient, only to their patient. Just I mentioned, Schedule C Biological and Special Products Act, it is allowed, but cannot open shop or cannot import drugs, and if at all they are interested to do so, then they will have to go for license. Have to keep record of the same. If at all you have dispensed medicine to your patient, then you have to keep register, that is called K register, and you will mention everything in that very register in detail. So what to do and how to prevent not to end up into any kind of litigation as far as ART practice is concerned. Registration of center, it is very much mandatory. No ART clinic, bank, surrogate clinic can function without registration. Either level 1, if you are interested to practice IUI, your center should be registered up to level 1, or if you are interested to all the procedure under ART, then your center should be registered as a level 2. But in any capacity, your center should be registered. If you are interested to run ART bank, then your lab should be registered under ART Act for ART Bank, or if you are interested to go for surrogacy practice, then your center should be registered as a surrogacy clinic. And if your center is registered, then you will be given registration for 5 years, and display of registration, this certificate at conspicuous place is very much mandatory. Renewal of registration in time, same way you have to apply, and in prescribed form with prescribed fee, and registration granted may be renewed for further period of 5 years, and no application for renewal shall be rejected without giving opportunity of being heard to the applicant. Eligibility, as we know, all the criteria are specifically given in ART law. So to avail ART procedure, women should be between 21 to 50, men should be between 21 to 55. Ovum donation, women should be 23 to 35. Semen donation, men should be 21 to 55. As far as surrogacy is concerned, for indenting couple, men should be 26 to 55 and women should be 23 to 50. So, and as far as surrogacy is concerned, surrogate should be 25 to 35 years of age, and they should be tested for all these tests. These are very much mandatory. You can go with other tests also, but these tests are very compulsory: HIV type 1 and 2, hepatitis B, hepatitis C, and VDRN. So donor gametes from registered ART bank only. It is very much mandatory. You can have donor gametes from registered ART bank only. And at the same way, registered bank will supply donor gametes to registered ART clinic only. So we should be very careful. As far as counseling is concerned, we have to give all the opportunity to couple to come to a conclusion, and we have to explain everything about procedure with its advantage, disadvantage, cost of procedure, and all medical side effects, including multiple pregnancy. We have to inform, and we have to help them to arrive at an informed decision about ART program. And we have to maintain confidentiality of patient. We cannot disclose personal identity of patient to anybody. If patient is willing to tell to anybody, that is up to her. But in clinic or outside clinic, whichever information we have received, we cannot share with anybody. This is very important part, that is grievance cell. Every ART clinic will have formation of grievance cell, and name of all the members of grievance cell you will have to display on the board. So any aggrieved person or any visitors of your ART clinic may complain before grievance cell as far as their grievance is concerned. As far as concern is concerned, at all possible stage, you have to take concern of all the party involved in ART program. So I do not want to go into detail. Withdrawal of consent. Patient is free to withdraw her consent before transfer is done. So at any stage, they can withdraw their consent also. Consent and agreement should be in local language. As far as insurance is concerned, for donor, home donor, for 1 year, for surrogate, for 3 years, and affidavit by intending couple before honorable court, that is judicial magistrate first class, that they have availed insurance for surrogate for 3 years and home donor for 1 year. As far as records are concerned, we have to keep all the accurate record, and in whichever state it is available online, then we have to send all this record online also to National Registry within stipulated time given, within period of 1 month from the date of receipt of such information. But still National Registry is not well functioning, but as soon as National Registry will be in full function, then we will have to give all this data online within 1 month. Preservation of record for 10 years, and then after all the records are to be transferred to National Registry. As far as surrogacy part is concerned, for 25 years, and as surrogacy part is concerned, There is no mention that after 25 years records are to be transferred to National Registry. So in surrogate program, after 25 years, you can destroy those records. If center is closed before 10 years, then at the time of closure, you will have to transfer all the record to National Registry. Preservation of record is concerned, then National Board, National Registry, State Board, or local authority who is authorized as far as ART Act is concerned, they have all the power to have visit to your clinic, and they can inspect all of your record whenever they visit your hospital. So provision for retrieval, transfer, supply and storage. This is very long discussion. I do not want to go into detail, but all these provisions are in ART Act, and we have to practice as per law. As far as storage is concerned, we can store for 10 years, and after 10 years, if at all they are interested to preserve for more period, then they will have to approach National Registry, and if National Registry permits or Honorable Court permits, then only we can preserve for more than 10 years. Otherwise, after 10 years, we will have to allow those embryo to perish. And if they have given consent, then we can transfer all those embryo for research purposes in recognized research center. So as far as some key points, and I will conclude, ensure that all unused gametes and embryos shall be preserved by ART clinic for use on the same recipient and shall not be used for any other couple. Allow cryopreservation, just I mentioned prior also, for 10 years, and if National Board permits, then you can preserve for more than 10 years. Ensure control ovarian stimulation of women in order to prevent ovarian hyperstimulation. But even with control ovarian stimulation, we never know, patient may go in OHSS. So at the time of counseling, we have to explain about that also. So to conclude with carry home message, minimizing claims, please apply for registration in time before you start your ART practice. In time renewal, display certificate of registration at conspicuous place, proper preservation and maintenance of record. Please maintain confidentiality of all parties involved in ART, sending record in time online to National Registry, prophylactic measures to prevent complications, meticulous management of complication if at all we have to face any complication in our patient, comply with the provisions of law, and have a medical legal opinion since point one if at all you are in doubt. There is always a way. These gentlemen have so many staircases, but he doesn't know how to use them. So it doesn't matter how many resources you have. If you do not know how to use them, they will never be enough. There are so many provisions in law in our favor as far as medical practice is concerned. But if we do not know, we cannot take advantage of those provisions at the time of facing litigation. So have some basic legal knowledge and always obtain medical legal advice whenever you are in doubt. So to conclude, if you want to sleep like this, take tender care of your patient. Practice as per standard provisions of ART Act. Pray our Almighty God before going to sleep, and keep my visiting card below your pillow.
Thank you, sir.
Only 1 minute. So to conclude with this appeal, please endorse my candidature for post of President Foxy next year, election year 2026. All the best. With regards, salute to organizers and Monica and Randir in particular for inviting me to share my views about the subject. Thank you very much. Please do not assume. Please ask if any query, any questions, if time and organizers permit.
Best
Thank you,
wishes
MC
to you,
sir.
sir.
Thank you, MC sir.
Sir, I just have one question for you, sir.
Yes.
Sir, actually, in the surrogacy rules of 2022, that prohibits the donor's egg. But there was a case into October 2023, Arun Mathur versus the Union of India, where in Mullerian algenesis, the donor's egg was used in surrogacy. So, sir, what is your take now, sir? What are we?
There was amendment and with that amendment now it is allowed.
Acha.
Previously, when this act was enacted, it was there that intending couple should have their own gametes, sperm and ovum. But with this amendment, now donor program is allowed.
Madam, we are having a number of such doubts to be solved in the panel, and now there is a fresh amendment to surrogacy rules wherein any one of the intending couple, either husband or wife, should have own gamete, and the other party who has got a medical indication can use a donor gamete, madam.
So, in short, as far as ART practice is concerned, either sperm or ovum or uterus, any one should be of couple.
Yes, madam.
Very, very perfect, MC sir. You have answered. I think in
Yes.
your slides now next, because I have seen you last 25 years, Foxy, PCPNDT, then legal cases and all. Now you have come with the ART because ART is a new act, but Dr. MC sir cannot be without complete knowledge of. As you know, sir, you are some district judge becomes then High Court, then Supreme Court. Now you are going to the Supreme Court, so you have to have all ART act and all. And very good, I got, sir, your message from this that तीनों में से एक होना चाहिए एटलीस्ट
तीनों में से एक चाहिए, either sperm or ovum or uterus.
Thank you.
Yes, sir. It was very lucid with very practical tips. You were always there. You are also a very, very great teacher. Thank you, sir. And very helpful always.
Thank you.
Thank you, MC Patel, sir, and best wishes for your candidature as Foxy President, sir.
Thank you.
All
MC sir, best, yeah.
Yes, thank
MC
you,
sir,
Ranbir.
best wishes from MP and everywhere, sir. Best wishes.
Yes, thank you. And one more request, or rather invitation. In month of February, Ahmedabad is going to host National ISAR Conference, and RG under able leadership of RG Patel, we all are working very hard to make it a grand success and remarkable one. So you are most welcome to Ahmedabad and feel our hospitality of Ahmedabad and Gujarat. Most welcome.
MC sir, उसके host आप नहीं है सर, हम सब हैं. और उसके पहले सर आपको 31 जनवरी और 1 फरवरी को हम सेंट्रल जोन का एमपी सार भोपाल में कर रहे हैं. अमित सर हैज कम बिल्कुल राइट परफेक्ट टाइम. अमित सर, so we were discussing, I think you will comment more, sir.
So it is a great pleasure and honor to welcome amongst us President ISAR, Dr. Amit Patki. Please put your hands together for our president. And sir, we welcome you with all our heart. It is because of you that ISAR Perfection Series has reached this, I called it blossoming of the series. So you are the person behind it. And just before you joined, before the first talk, Dr. Nandita Palshetkar, who presided as chief guest, remarked that it is very awesome that you could, revive this series again. And sir had to persuade and nudge me a number of times, Monica, why aren't you starting it again? Why aren't you starting it again? And ultimately we started with a bang, and we are already on the 7th episode. Thank you so much, sir. And it's always an honor to introduce you, sir. Everybody knows you as the current president of ISAR, who has given us an amazing 2 years tenure full of academics, full of excellence. We cannot attain perfection, but if we chase perfection, we can catch excellence. So that is the dictum which totally fits Amit sir. He has given us, Manisha is there. So you will vouch for it. There is not a city or a state where sir has not done masterclass, and he has involved every Isarian in the masterclass. There are, there are meetings, there are consensus, there are discussions, and there are virtual fights also as to what concept is right. And then the final word, sir gives with a lot of reasoning and a lot of logic. He is a terrific academician, a great speaker with so many publications, and he has led ISAR right, at the forefront. And you have taken ISAR to a place, sir. The next president will have a hell of a job to, carry on the legacy like this, sir. Thank you so much for joining, sir.
Just one word from me is for Amit sir. Amit sir, just in 10 seconds I got that, sir. We have seen many ISAR president and all, and ISAR body. I think Monica, the perfection series we started, I think at present the perfect president this year, Dr. Amit sir, when he started his introduction in Bhubaneswar last 2 years back. Sir, we salute you. You are the perfection in everywhere. आपके चेहरे पे कभी किसी के लिए नाराजगी नहीं होती. Always smiling, but you are very strict by the heart. Salute you, sir. Welcome, sir.
Thank you very much, and a very good evening to you all. At the onset, I must thank Dr. Monica for this excellent perfection series, part two that she is doing for us. And every time that you come up with a brilliant topic and a brilliant faculty. Today, I was listening to Professor MC Patel, and the fine nuances that he has spoken on the ART law is admirable. And I'm sure it's going to help all the listeners in having a very good ethical and legal practice. I look forward to Dr. Jyoti Banglowala and then an interesting panel on Surrogacy Act, because these are things that we are facing day in and day out, and it is extremely important that we make ourselves aware and we learn to stay within the bylaws of the ART and Surrogacy Act, because only then and then can we do a practice which will ensure that we do not come into any medico legal problems. So I'm glad and happy that Perfection series has devoted this full webinar on the ART and Medico Legal Act, and I look forward to listening to more sound advice from our faculty. So once again, thank you, Dr. Randir, thank you, Dr. Monica, and all the co-conveners. And as Dr. MC Patel and Dr. Randir had said, that all Isarians are looking forward to the annual Isar in Ahmedabad. And I personally welcome all of you 20, 21, and 22 in the beautiful city of Ahmedabad, where I'm sure we are going to be looked after well, because I know Gujarat can be very good host as far as your cultural and culinary delights are concerned, and they have managed to get a large number of very good international faculty. So we'll have very good academic sessions with our international and our national faculty. And I invite each and every one of you to this wonderful annual ISAR. Thank you very much, and I hope we all enjoy the rest of the proceedings.
Thank you very much, Dr. Amit Patki, sir. You could spare time, your precious minutes. I know you're working. So thank you so much, sir, for the encouragement. I promise you we will carry the legacy of ISAR forward, carry the torch in our hands and hand it over to the youngsters to carry it forward as well. So thank you, sir.
Thank you, Monica.
Thank
Thank
you,
you.
sir. And now there's one more guest in our program who has just joined. There was some confusion with the time. It's Monica Gupta, my namesake, and she is from Alwar. We can see her wonderful work in the form of multiple webinars, coordination, and Monica will agree. I do just 1 or 2 webinars a month, but she's doing one practically every week. So hats off to you, hats off to you, Monica, for that energy. You are a bundle of energy. And anytime you call her, whether it's 11 p.m. or 7 a.m., she's always fresh, she's always active. We know her tremendous amount of work as a West Zone coordinator in the PAC committee. But besides that, she, takes in multiple topics in her webinars and, gives us great inputs. And she is a wonderful coordinator, a great friend. We can see how much work she has done in Foxy. So over to you, Monica. We'd like to have a few words from you before we proceed.
Thank you, Monica. Thank you for the kind introduction. I'm not that great as you are. You are persistently doing the Perfection Series 1 and now 2. Your passion is, hats off to your passion. You are really passionate about your work. And this time, the topic you have chosen, surrogacy, that is very important, not only for the ISAR members who are doing ART practice, but also for the other members, because it includes legal issues, emotional, and many times abuse also to the person who are getting the surrogacy, money involved, and so many things. And people are not knowing much about it, because nowadays new laws are coming. So it is very important for not only for the persons who are doing ART practice, but also to the practitioner who are referring the patient for the surrogacy should also know what are the norms. And this is a very wonderful topic, and you have chosen such a nice, excellent medical legal expert, MC Patel sir and Jyoti Banglowala madam, and the panel you are conducting, and the panelists, hats off to you. And I wish you a great success in your future and yours also in ISAR as well as the Foxy. Thank you very much for inviting me and making me a part of your conference webinar. Thank you very much.
Thank you, Dr. Monica Gupta, for joining and giving us your, words of blessings. And now I would like to hand over the program to Dr. Purva Bhatkur, our ABLE coordinator, to start the session too.
Thank you so much, ma'am. So, moving to our second academic session, that is medical legal aspects of gamete freezing. I invite Chairperson Dr. Rita Bakshi, madam, Dr. Sam P. Abraham, sir, Dr. Vinita Agrawal, madam. Dr. Rita Bakshi, madam, is a fertility expert from Delhi. She is honorary professor at Rohilkhand Medical College, Bareilly. She is editor of many journals like Journal of Reproductive Health and Medicine, International Journal of Recent Development in Science and Medicine. She is also president of Rotary Club of Delhi City and a very enthusiastic academician as well as a very active member of Delhi OBGY Society. She has been awarded as Distinguished Doctor Award by Delhi Medical Association, IVF Excellence Award, and many more to her credit. We welcome you, ma'am, to chair the session. Next, we have Dr. Sampri Abraham, sir. Sir is a true specialist in obstetric and gynae and is affiliated with Foxy. He has won various awards for his excellence in work in fertility, like Millennium Award for Excellency Work, Athura Seva Award for Patient Care, Gandhi Puraskaram for his excellence in field of infertility. We welcome you, sir. Next, we have Dr. Vinita Agarwal, madam. Madam is presently senior gynecologist and infertility specialist at Agra Hospital and Fertility Center, Jaipur. She is also associate IVF specialist at Planet Women Hospital, Ahmedabad, and is a true academician and active member of ISAR Foxy IOGS. We welcome you, ma'am. Now I hand over session to the chairperson to introduce our speaker, Dr. Jyoti Banglowala, madam.
Thank you so much, Dr. Monica and Dr. Randhir, first of all, for giving me an opportunity to be part of your session. And let me, I've heard your Hindi, and today I'm marveling at the control of language that both of you have. So seriously, last time when I heard your Hindi, it was par excellence. I know you belong to the Hindi land, but the control was fabulous. So thank you so much, Monica and Dr. Randhir again. Introducing our speaker, Dr. Jyoti Banglowala. She is the chairperson of Ethics and Medical Legal Committee, Foxy, and she's had huge experience. We've all been hearing her name right now. She's a medical legal advisor, vice president, Indore Obs and Gynae Society, and secretary. She was in 21-22, treasurer. She's an IMA representative for the MTP committee, Indore, coordinator of medical. So I think you have the right medical legal person speaking on the topic. She's an editor, medical legal. She's been AICOG medical legal workshop coordinator, editor, recipient of many awards, MS Signature Award, Wonder Foxian Awards, Indore IMA Corona. Well, she has so many awards and papers. So welcome, Dr. Jyoti Banglowala. Stage is all yours. We're waiting to hear you.
Thank you. Thank you very much, madam. First of all, actually, I must thank Dr. Monica and Dr. Randhi, who just bring me in the ISAR Perfection series. This is actually, ISAR is not my domain, but this is a medical legal, this webinar they have conducted. And thank you, Dr. Amit Patki sir, Dr. Asha Bakshi madam, Nandita madam, Charmila, Dr. Shweta, Monica, everybody for their nice words. And it is my honor to present topic in front of Dr. MC Patel, Dr. RG Patel, and even my faculties, my chairpersons, Dr. Rita Bakshi ma'am, Dr. Vinita Agrawal, Dr. Sam Abraham. You all are so big fertility experts, and I have chosen the topic very nuanced. This topic still is under, globally it is the upcoming branch, gamete freezing. and we are not having that much exposure about the gamete freezing. There are few, I can say there are few organizations who are working about the fertility preservation of the cancer patient. And everything we are coming with for this laws for the gamete freezing are coming from the most of the time the cancer patient previously. There is one organization we all are knowing that that is you can say this Livestrong. Everybody, you all are knowing that Livestrong is the organization we all know. They are working for the cancer patient and they are come up with all the guidelines previously. And then rest of the world they are taking with the advice from the Livestrong Foundation. So this is a very crisp topic and I am sharing. Please allow me to share the. Is it visible, Monica?
अभी नहीं visible है ज्योति. Yes. No.
Is it visible?
Not yet.
Just 1 minute now.
नहीं अभी नहीं है. No ज्योति.
1 minute.
Just take your time.
Yes. I think now, because at my side I am seeing it is visible.
No, it's not coming.
So, Jyoti, you can
Just
do one
1
thing. You
minute.
can leave the meeting and come again.
Yeah, I think it's loading.
Started.
Jyoti is loading. Yeah, got it.
Okay. So this topic actually, just 1 minute. So everybody, you all know, and this previously we just heard MC Patel sir about all the things in the ART Act and every cases we have seen since last many years we are seeing uh, this fertility preservation, the what is the eligible couple, who is the commissioning couple, what should be the laws for means you all have just Shivani said when the ART Act came, then that amended act came, there is a storm. Now this fertility preservation is the another storm. Actually, you all know this fertility preservation, it encompasses a spectrum of clinical and laboratory-based intervention, and it aims at the safeguarding an individual's reproductive potential for future use. Previously, we are just thinking about the cancer patient or some if the patient is undergoing some chemotherapy or radiotherapy or surgical intervention. But now the increasing fertility preservation is not only for this medical topics. It is the mitigate the age-related decline in reproductive capacity. Also, just girls are just nowadays we all are seeing even our daughters, even our sons, they are just studying till the age of 28, 30, 32. They are just doing their fellowships, they are doing their PhD, and then they just think about marrying. And after that, they think about producing the kids or children. So the age, what we Asians are saying, previously, when we are in the medical college, we are saying, oh, it is this girl is 28 years old. Now she is entering in the high risk category. Now each and every girl who is coming to us is the high risk category girl. Most of the girls are coming to us after 30 or 32. So now on demand, this gamete freezing is going. Means we all know this on demand, these things are coming. So there is the medical legal consideration associated with fertility preservation. They are extensive and intersect with ethical principles, regulatory frameworks, clinical governance, and patient rights. And the key issues involving are autonomy in the reproductive decision making, validity and scope of informed consent, and custodial rights over cryopreserved gametes and embryos, and the management of the potential conflicts regarding their future use. Most of the time, unmarried girls are coming for the preservation. Most of the time, unmarried boys are coming for the preservation. So now this, as told you, this is an upcoming thing. Now, our social, means our ethically and socially, and as such, we are seeing in India, we are not that much liberal in mind that a girl is coming to our clinic and she is saying, Doctor, I want to study, so just freeze my oocytes. We are just not used to hear these things. So there are so many things involved. Now, the cryopreservation or vitrification, this is actually the freezing of sperm, eggs, embryos for the future. And this is the most common method. Ovarian tissue freezing. This is the surgical procedure and then which can later be transplanted back into the body. These are the basic things, and this is not for the pure ISAR people. As Monica has circulated this SR Perfection series to all the Foxy platform also. This is just a basic knowledge for what the ovarian, what is this preservation. And the semen banking also, this is the collection and freezing of sperm, typically for man undergoing, and the treatments that may impair fertility, and then embryo freezing, that is the creation and freezing of embryo for later implantation. So we are knowing the tendency towards the postponement of the motherhood and the advances in the laboratory technology. These are the encouraging factors for women to consider oocyte vitrification and increase their reproductive autonomy. Mainly, my topic is just related to the autonomy of the patient. What the woman can do, what is their right to do or not to do. This has come to represent the standard of care for fertility preservation for women who choose to postpone motherhood, either by choice, like social egg freezing, or owing to receiving a diagnosis of malignancy or endometriosis, or just receiving something, or there is removal of some organ. So there are, most of the time we are just getting the patient like the social egg freezing, and second is for the cancer patient. So the fertility preservation in cancer patients, and then the oocyte vitrification for women and sperm banking for man, who are considered the first line fertility preservation options at the present time for cancer patients only undergoing treatment. Then emerging techniques are promising. Everybody is promising that just come and preserve your oocytes, preserve your sperm, preserve your embryos, such as cryopreservation in orthotopic models of ovarian and testicle tissues. And everybody is giving actually guarantee that yes, when we will use this after 3 years or 2 years, it will be as good as the fresh. So these are the modern techniques are coming, and this means they are having the experience. The doctors are having experience. Technology is going up and up. So these techniques are coming. So artificial ovaries or in the vitro culture prior to the auto transplantation or cryopreserved tissues. So there are two things we are seeing. First, when you are, means the patient is having in the problem and patient is coming to doctor or the center, and now the doctor is convincing the patient because the technology is actually evolved. Our techniques are evolved and we are living in the modern era of the technology. So these things are actually coming up and up. Now we have to see the ethical landscape. The ethical landscape of fertility preservation is very complex. Actually, it encompasses multiple dimensions and several critical issues warrants careful evaluation. And it includes autonomy and informed consent for the patient, access and equity for the patient, the parental rights, and posthumous reproduction. We are not much seeing in India this posthumous reproduction. Very few we are seeing, but still this is actually a domain for the ethical landscape. So we have to first the patient autonomy. As a medical legal person, as a doctor, I will always say, and I would say that respect for patient autonomy is must, and it is the central to fertility preservation. The individual must receive transparent, evidence-based information regarding the potential risks, benefit, limitation, and uncertainties also of available preservation techniques. Valid informed consent requires a thorough counseling process. We have to counsel the patient, the person, the male or female, again and again and again. Actually, we have to tell each and everything, addressing procedural steps, success probabilities, failure probabilities also, long-term implication, and possible future scenarios. It is not like we have to just give false hopes to the patient. If we are seeing some, there are the limitation of each and every procedure. There is uncertainty of each and every procedure. So you have to tell all the benefits, all the risk to the patient related to the use, storage, or disposition of the gametes or embryos. And actually, this particular thing ensures that the patient's decision is voluntary. After so much counseling, that the patient is saying, no, I am not ready for this freezing, it's okay. And actually, you should take it in a well-considered manner and align with their reproductive goals. If patient is coming to you that she wants to freeze eggs, she wants to freeze egg for the social, just for social cause, she want to postpone this pregnancy for if she's studying or she's on the job, anything. And after counseling, if she thinks okay, there is also risk involved in this, and she says no, then we have to just respect the patient autonomy. Then we are living in India, the much crowded country in the South means Asia, and we are seeing there is a very much diversity in our social nitty-gritty things. We are seeing there is the access to fertility preservation is very uneven. Actually, the marginalized groups facing the greatest barrier. Everybody knows it takes so much money to do any ART thing, we need money. And we are just seeing there is a ratio of 30 to 70. Means there are 70% we can see the patient who cannot afford this type of treatment. And even the government is actually coming with the, for the IVF, they are giving so much liberty to their state governments, but still the freezing techniques, they are not getting that much from the even the insurance agents or the state, even state means governments, there are not that much support. So we have to just see the marginalized group also, and they are actually facing the greatest barrier. There is the legal and policy measures are needed to reduce these disparities and ensure fair, affordable, and inclusive availability of the service. Because the five patients are coming to your clinic, the four are not affording, but they want the freezing, but they cannot afford. So there should be access to fertility preservation from the government side, from the social side also. And when the embryos are created, determining the ownership, control, disposal can become legally complex, and particularly after divorce or separation. So these things should be like, we are doing webinars from the doctors for the doctors, but about the general people, they are not knowing that this particular thing is so much complex legally also. There is less awareness, and we should spread the awareness about that. There should be clear legal guidelines that should be essential to address these disputes, and there should be well informed consent, and it should be always taken here. We are seeing in the ARTA, they are just providing few forms. Now we are just, as we are running a solo clinic for this ART. So we have to be very safer side. If you want that informed consent must add something else. You are seeing the couple, you are seeing the girl, you are seeing the man, and you are thinking, no, I should take some different type of consent. You should always take. You should inform each and everything to the patient, and you should take the consent properly. Using stored gamete or embryos after an individual's death, it raises major ethical and legal challenges, even in India also. So clear consent, the rights of any resulting offspring, and inheritance implication must be carefully addressed. We are having, there are few cases because the posthumous, this, who can just use this gametes. This is a major issue if the, and who have freezes the semen or oocyte, and if he or she died and there is no clear cut evidence of giving the consent, who can use this, then it may become a problem. So the legal landscape governing fertility preservation is still evolving, and the key issues are regulatory bodies. In India, we are having ART Act. It provides the reference framework for assisted reproductive medicine participation, and it is amended right now. Just MC Patel sir told it is amended. Still, it is not addressing properly the freezing. The informed consent laws, we have to just obey the informed consent laws in general, not like ART Act. In general, we have to just obey the informed consent laws. And disputes over frozen embryos, we have to just keep this in mind. And the insurance and financial consideration, we have to keep this also in the mind, that we have to tell this patient again and again and again that it may become a costly affair. So if you are having insurance, just see properly the insurance is covering it or not. Now the information, this informed consent, because everybody knows that is a fundamental medical legal requirement for every patient, and especially in the fertility preservation. And this consent process should clearly encompasses few things. First, the comprehensive information. The patient must be provided with clear, detailed information regarding the procedure involved, the associated risks, expected success rates, possible psychological impacts also. This is particularly crucial for the individual recently diagnosed with the malignancy, because already they are psychologically disturbed and then they are coming for the freezing. So you have to just see for their means what the psychological they are going through. And an empathetic, supportive, and patient-centric approach by the clinical team is therefore essential. It is not like you are just robotic way. You are saying you just diagnosed as a malignancy and you go and freeze your eggs. You go and freeze your semen. No, you have to just give her or him psychological support. If the patient needs some psychological treatment, also let her take the treatment and then advise for the advice, then give the another information about the freezing. So patient should understand the options also. The actually patient should fully understand all available fertility preservation options. It is not like what you are knowing or what you are comfortable with. You have to give all the option to the patient, including the possibility of requiring multiple cycle of oocyte retrieval or sperm collection. They must also be counseled about the medical, logistical, and financial complication of each choice to ensure informed and autonomous decision making. Sometimes patient is not knowing. The cycle may fail. She has to come for 2 or 3 or 4 times from the working place or from the nearby village or town. So you have to tell in a very careful manner that it may take time, it may take a logistic approach for this, or it may get high finances also. So if the patient says if she is not wanting this decision to continue this treatment, anytime she can withdraw her consent. Then future use of gametes or embryos always be ensured, and patient must provide clear consent regarding the future use of their stored gametes, including who may access them or under what conditions. Establishing these directives in advance helps prevent disputes and ensures alignment with the patient's reproductive intentions. Unmarried girl is coming to you and she is not signing the consent. Who will use this gamete? By chance, some accident happens to that girl. By chance, some malignancy happened to that girl. Previously, she is coming for just social egg freezing. Now, something happens to that. Who will just can use the gametes? So you have to be very much ensured from your side that to take the consent for the future use also. Then revocation of consent. The patient should be clearly informed of their right to withdraw consent for the use of their gametes or embryo at any stage. They must understand the implication of revocation also and the requirement that such withdrawal be submitted in writing. The process and mechanism for revoking consent should be explained in advance to ensure clarity and legal compliance. Just as a part of informed consent, there is any time they can just withdraw their consent, anytime they can withdraw from the procedure, anytime they can revoke the consent. So this liberty should be given to the patient, and in the first few counseling only you have to tell clearly about this. There should be the psychological consideration also. The individual may face significant emotional stress during the fertility preservation, and these key areas include counseling and support, as the psychological counseling helps patient manage anxiety and emotional burden they are having. There are the long-term implications because the patients must understand that future conception may not be guaranteed. It is not that just to show all the rosy pictures to them. You have to tell all the risk also, and the patient must understand that in future it may fail also, and the impact on the relationships. Differing view on the use of stored gametes or embryo can create relationship strains between the husband, wife, mother, daughter, or mother, son, or father, daughter, or father, son, or even the living partners also. So there are a huge impact on the relationship, and you have to just counsel about them also. Now you can see the ART Act 2021. We all are knowing there is a actually change we have seen, but still we are just upcoming with all the new things. And as per the stipulation of the ART Act 2021, there are several provisions regarding the use of cryopreserved gametes and embryos, and some are these being highlighted. Like the clinics and banks shall not cryopreserve any human embryos or gamete without specific instruction and consent. We each and everyone who are attending, not attending, everybody is knowing that actually without consent we cannot do anything. So everything should be in the writing. In case of death or incapacity of any of the parties, so we have to take a proper consent. The collection of gametes posthumously shall be done only if the prior consent of the commissioning couple is available in such manner as may be prescribed. All unused oocytes shall be preserved by the bank for use on the same recipient or given for the research to an organization registered under this act after seeking written consent from the commissioning couple. So, as Patel sir already told you, when you are not using these gametes, when you are not using this embryo, when you are not using oocytes or sperm, we are having a clear-cut consent. After this year, if you are not using this, and when you are donating this to the organization, and means to the registry, you should have the written consent from the commissioning couple or the male or female individually. Monica, this is actual, yes. An embryo shall be stored for a period of not more than 10 years, and at the end of such period, such embryo shall be allowed to perish or to be donated to the research organization under this act. And the cell transfer use of gametes, zygotes, embryos, or any part thereof, information related to directly or indirectly to any party within or outside India shall be prohibited. So actually, in the case of transfer of own gametes and embryo for personal use with the permission of the national board, this Patel sir actually very clearly told with the help of this case studies also, we shall not do such things, and you have to take the written consent for the same. The use of any human gametes and embryos of their transfer to any country outside the India for research is absolutely prohibited. The child born through assisted means ART technique shall be deemed to be a biological child of the commissioning couple, and such child shall be entitled to all the rights and privilege. So if the unmarried girl, she is coming for this technique, you have to just tell that this boy, the child which is born, means the biological child is having all the rights and privileges. So any medical geneticist, these are the simple ART Act. I have taken all from this ART Act, simply same as it is written. Any medical geneticist, gynecologist, registered medical practitioner, or any person shall not sell human gametes, run an agency or racket or organization for selling or purchasing, and whoever contravenes this provision shall be punished. So actually, it is not this punishment we all are knowing. So we have to know, means we have to be very careful about that. This is a very punishable offense. The payment written here is only 10 lakh rupees, but the procedure for the punishment is very, very bad. So we have to just keep care of this. Where an offensive under this act has been committed by any clinic or bank, the executive head of such clinic or bank shall be deemed to be guilty of an offense and shall be liable to the proceed against and punished accordingly unless he proves that the offense was committed without his knowledge. So now this, we all know, this is just I said, this is the evolving thing, and we have to just see the informed consent is the base, first thing. Who will use if something happens to the patient? Who is having the right upon this gamete? And if we are not using this gamete, what should we do? So there are only 2 or 3 case scenarios I have taken. First is, this is a very, very, very renowned case we all know. This is the case, this is the one of the most prominent recent cases. A 30-year-old unmarried man diagnosed with non-Hodgkin's lymphoma. He cryopreserved his semen at Sir Gangaram Hospital on medical advice before starting chemotherapy in 2020. He died shortly after without a will or explicit consent for posthumous use. Now, his mother, means his parents in their 60s, sought access to the sample to have grandchild through surrogacy to carry on his legacy. The hospital refused to release the sample without a court order, citing the lack of specific guidelines in the Assisted Reproductive Technology Act in 2021. Now the court ruling was, in October 24 only this come, the Delhi High Court in a landmark decision allowed the parents' plea. Justice Pratibha Singh ruled that semen and reproductive material constitute as a property. It is constituted as a property or estate of an individual, like our home, like our car, like our clinic. It is a property to the individual. Under the Hindu Succession Act, the parents were the legal heirs in the absence of a spouse or children and were entitled to the property, means the sperm sample. There is no general prohibition against posthumous reproduction under current Indian law if the deceased consent can be reasonably demonstrated. The act of cryopreservation itself was considered an indication of the intent to have biological offspring. The court noted each case must be judged on its specific fact with the welfare of the future child being paramount. This is the landmark judgment. But here one thing, that boy was unmarried, 30-year-old unmarried man. So parents actually they fought for this semen. Here, if the boy was married, then there is a conflict of interest between the spouse and the parents. Then the judgment would have differed. Here the boy was unmarried, so judgment was in favor of parents. The second case is, this is the ongoing case, still ongoing in the Bombay High Court. Actually, it highlights dispute between the estranged partner over frozen embryos. A couple, they froze 16 embryos after their marriage in 2021. Their marriage letter sold in 2023. The 46 years old woman wants to use the embryos to have a child and transfer them to another clinic. But her husband is blocking the transfer. Now, the legal issue is the case raises complex question about the spousal consent, a woman's right to bodily autonomy, part of the right to life under Article 21, and the legal status and ownership of pre-existing frozen embryos, especially given the strict condition and age limit introduced by the new IRT law and surrogacy law. And the woman's petition argues her will should have primacy in matters instinctively tied to her body. Now, the second case, it is actually our dear friend Amit Karkhanis is fighting this case, and most probably we all are just seeing the day-to-day whenever this hearing is there. We all are knowing the 46-year-old woman. She should have their embryos. There are 16 embryos. The court should give the permission for to use the embryos, but no. We are not thinking it as a dil se nahi soch rahe. It is not by heart. It is by law. And law is saying she needs permission of husband. So whenever such cases are coming, we have to take informed consent and a proper consent in cases of dispute. Who will use these embryos? If the husband and wife get separated, who will use this gamete? So third case is, actually, it is the allegation of negligence, lack of informed consent, and even fraud of fertility clinics. A Kolkata couple sued an IVF clinic after discovering during a medical crisis for their daughter, who needed a bone marrow transplant, that the child was born from a donor embryo, not their own genetic material, as they had allegedly not been informed or consented to the use of donor gametes. The NCDRC has handled cases where patient alleged negligence due to IVF failure or discarding of the embryos without consent. Court have generally held that failure to conceive does not automatically imply negligence, but a lack of proper consent or documentation can lead a liability. So this IVF clinic actually they lost the case. The fourth case is a Mumbai woman is in the legal battle. Again, that's the same case. The fifth case is in the 2025 case, the Delhi High Court allowed the family of the man. By suicide, he died. First case we have seen, that was the cancer patient. Here the patient died of suicide to perform post-mortem sperm retrieval. The court directed the hospital to preserve the retrieved sperm using standard medical protocols. The court again noted that semen sample qualify as a property under Indian law, and as a Hindu law, the property belonged to the parents, making them part of descendants' estate. So here we have to just see the social and cultural background of our country, and when posthumously, most of the time, as it's like we are seeing few cases coming to us when the husband is working in army and they are going for war front and they are just want to just freeze their semen, so sperm. So we have to just take the consent about posthumously who can use this semen. Parents can also just they also can sue the clinic. Five can sue the clinic. So there should be a clear-cut informed consent about the use posthumously. Now, the defined legal recognition of cryopreserved gamete as a part of person, state, or property, they show how courts are handling posthumous reproduction in the absence of clear statutory guidelines, especially under the ART regulation, and they illustrate real disputes over ownership, consent, inheritance of reproductive material. So we have to be very clear that reproductive material, whether it is a male or female reproductive parts, they are just, court is saying that as a state, as a property, and they set precedents for future cases involving fertility preservation. So cancer patient or elective preservation, they are this property of the patient, and there should be clear remarcation about who can use. Now, we are not evolved that much in the freezing. So future directives, the source as our society is evolving, and so there will be medical legal aspect of the fertility preservation. In the future, the technology is advancing and evolving fertility preservation methods will be requiring update legal and ethical guidelines. Still in our ART Act, there are not that much clear-cut legal or ethical guidelines. We have to just very much clear about taking consent and very much clear about the use of the material we have preserved. Changing social norms. We are seeing the shift in attitudes toward the family and reproductive will influence future laws and access. Still, we are in the just seeing what will happen. And there is the awareness. There is the increased public and professional awareness demands continuous ethical and legal education. There should be policy development. This should be stronger, comprehensive policies will be essential to ensure ethical, equitable fertility preservation. Social egg freezing, I have not just said nothing. Just like I said, only one or two lines, like the girls are just increasing age is a big thing. And then the demand of their jobs, demand of their careers, many girls are coming for the social egg freezing. But the who will take after this girl, who will take the right for this, whose side, this should be very clear. With love and care, thank you. Thank you very much.
Thank you, Dr. Jyoti. It was a great, insightful, and an incredibly brilliant talk on the all aspects of the gamete freezing. You have covered all the topics, and it is a great message to all the practicing people that before doing all these practices, one should always know what are the all medical legal aspects, and before doing everything in the technical terms, they should know the legal aspects of all these freezing, gamete freezing, because gamete freezing is nowadays is the essence of the total ART practices, and it is the people talk in a very cool manner that we'll go for social freezing because of the late marriages and the late parenthood. They are talking everything in a very simple sense, but the doctor, the practitioner who has to do this work, they should be well aware of all these aspects. You have well covered the topic in a very comprehensive way and a nice manner. I congratulate you for the very, very overall insightful the light you have put on this topic. Thank you, Dr. Jyoti.
Thank you, ma'am. Actually, social egg freezing, Rita madam, after social egg freezing, unmarried girls are coming for social egg freezing. But our social scenario is not like that much liberated. When this girl is going to marry, and if she wants to use this eggs, is her husband permitting her? There are so many things we have to just take. Otherwise, just you are freezing their eggs, and after 10 years, you are discarding them. That is not the thing you have to do as a ART practitioner. You have to just see, you have to just counsel the girl. Is it useful for that? It is not like seeing some few serials, seeing and reading in few newspaper and the girl is coming to you for social egg freezing. Unmarried girls, you have to counsel again and again and again. After marriage, are you able to use these oocytes? No. If no, then don't encourage her.
Dr. Jyoti, on this front, I would like to just intervene for a minute to say,
yes, ma'am.
I had this girl walk in, she was from Rajasthan, and she walked into me and said, Doctor, I want to, she had migrated from US, where egg freezing is very, very common. And she said, whenever I went to a doctor, they said, chal jaake shadi kar pehle. So she was around 41 and she had not found the right partner. So when she came to us, we said, let us look at you first, whether your eggs are there, whether they are free, whether you still have some ovarian reserve left. So I think it's time that we as doctors also go, out of our judgments and, because this is a science. We know that vitrified eggs now are, and 90% are viable. So I don't think we should give out as a science. We should not be. One more point I do want to say, that as a law, your gametes can go out when you are going out, but we at the moment, if you want to import our own gametes which have been frozen, it is not there.
Not
So
possible.
it's time, the court, and this is going to be just because I know the other day I had a patient who had frozen her eggs in US, and she wanted to do surrogacy in India, and but I told her, first you'll have to go to the court, you have to get permission to get your own eggs whether she'll be able to get them to India. So this is one. Third thing I just want to say, the other day I had an accident, near All India Institute of Medical Sciences, and I had a dead body walking up to my center saying that, can you please retrieve the sperms? So now I said, you were so close to All India Institute, you should have gone there. But All India Institute people also had raised their hands because they said, we don't know what the law says. Just because it was a trauma, the boy had just died and they were paid. So I think it's time when we are looking at posthumous laws more closely. Of course, now we are all getting signatures of who will use the gametes, whatever we are freezing. It has become very, very clear whether husband, wife, parents, or research, or whatever we will do. But I think these laws are now coming of age, and we will have to be more vigilant, more cognizant of the changing society. Thank you.
Madam Posthumous, I just gave one case that the boy died with the suicide. So the court gave permission to use the retrieve the sperm from semen from that boy. But like the road traffic accident, the laws are evolving. These are not that much common law like the MTP Act or
Absolutely.
TCP entity that even if the body is coming to my clinic and I can retrieve. I have to
Yes,
just read again and again what the AIT
absolutely.
Act is saying.
That is what I also mean.
Yeah,
I
so
think laws will keep
there should be
evolving.
general awareness about all the laws. There should be like some girls. I am the just basic obstetrician and gynecologist. When I am sending patient to the IVF specialist, most of the time the girls are coming back and saying, "आंटी हम तो आपको कॉलेज से जानते थे, आपने पहले क्यों नहीं बोला कि फ्रीज कर सकते थे? Now the IVF specialist is saying कि अभी नहीं है X." So we also feel very sorry. So general awareness must be evoked through the ISAR, through the FOXY, through the just like we are doing so much social programs. Also, the general awareness should be there. To just mother means the parent can also encourage their girls, their boys to just freeze their fertility, means preserve their fertility. But in general scenario, it is not that much possible. We are just talking here hypothetical. In general, it is not possible, and that's why we need such type of webinar for the doctors and for our patients.
Yes.
Thank you, Dr. Jyoti. You have covered a lot in detail, but one thing I have been taught by our teachers that see, law is always to not to strict, to not to restrict. बट एक चीज हमको बताया गया हमेशा इन सुप्रीम कोर्ट ऑल्सो गोइंग टू द जैकोब मैथ्यूज एंड ऑल, कोई चीज आपने गुड फेथ में किया है और उसको आप जस्टिफाई करते हो, यू आर नेवर एट ए मिस्टेक. सो मैडम आई जस्ट वाज गोइंग दैट आपने कहा ज्योति कि एक सुसाइड था एंड देन यू डिड इट. ऐसे मैडम एक्सीडेंट पेशेंट्स भी आते हैं, तो इफ दे आर आस्किंग फॉर एनी preservation of sperm and all, you can do it.
We can do
But
it with the
before,
permission of the authority, with the
yeah,
parent.
so that parent is very important. And yesterday, 2 days back, one army major came. He's 32 year, posted in somewhere, and he came. He wanted to preserve the sperm. तो as you very well, मैंने as very well ज्योति, हम लोग पहले बोलते थे कोई भी कि पहले हर गायनिक बोलता था कि पहले शादी कर लो, शादी कर लो. But now the thing has come. Now we have to change the attitude because Dr. Monica knows very well, a great politician. They have got 2 daughters. They both are out abroad, and they are now nearly 40s. Last 10 years से जिनके पास भी गए हैं उन्होंने कहा नहीं अभी egg freezing मत करो, शादी कर लो, शादी कर लो. So now it's very good concept you have taken, ज्योति. आपको उसने कहा आंटी मैं आपको जानती थी, आप तो मुझे कभी एडवाइस नहीं किया egg freezing के लिए. I think that is a gray area, and we have to teach because we are the people see on us, we doctors.
Yes.
Thank you. Great
Actually,
lightning
we have to be, just Madam said, we should not be very judgmental. We have to see our own people just like a patient. It is not like my relative. She is I should see her as my patient, what I can do best for my patient. So it is the take home message is that one thing. Social egg freezing, I just told you. There are the things coming. We are, as a gynecologist, I am seeing so many girls in the medical college, 26, 27, 28 is the age they are just studying. So if they want to just preserve their eggs, they want to preserve, the boys want to, it is good, always good. But there is like said you said, one army man came to us, just being a very very simple ordinary gynecologist. I sent him to a uh, IVF clinic. He preserved and he died actually. Now the fight is over the preserve the wife and the parents. They are fighting. So the clear directive is, if the wife is alive and if wife falls, this they just said the social. They have to see the age that the child is if the child is born, who can take great care of that child? Not the old parents, but the young wife. So still the case is ongoing. There are so many aspects we have to see. Posthumous use aspect we have to see very cleverly actually. Posthumously
Yeah,
we
but now we are getting, that's very good. Now we are getting, because now organ donation is going on, so the child might or donate her liver, everything, and all, and testis they want that they preserve for that. So they're good questions. Now we think we should,
Dr.
as you told.
Yeah, Dr. Randhi, even the question of property rights also comes up here.
Yes,
So
because
Absolutely, lot,
because
nowadays,
lot.
the child
whether the
child is the higher. They are saying the semen and the oocyte are the property or state of the individual, and the child born of this property is also higher of the whole property also. So we have to take so much social consideration. And as I said, there are not that much written in the ART Act 2021, and it is still a evolving thing. And maybe after 1 year, I can say a better thing over this your
more
perfection
of such
series.
cases, let them come up, then we'll all be more clearer.
Yes,
Thank you.
thank you,
Thank
ma'am.
you,
Thank you.
And we know all very well, Dr. Jyoti Bakshi ma'am, that this ART Act has come in hurry. मैं हमेशा बोलता हूँ कि एक्ट बहुत जल्दी में आया है, और
जी
ये वन ऑफ द जल्दीएस्ट एक्ट हुआ है. तो इसमें जो भी आप करेंगे, जैसे अभी सरोगेसी में था, ओनली यू हैव टू हैव योर ओन एग्स, योर ओन स्पर्म,
Yeah.
डिसीजन आया. तो आई थिंक वी विल कंटिन्यू, एंड ग्रे एरियाज का रिजल्ट्स आएंगे.
जी मैम जी थैंक यू थैंक यू Abraham sir,
thank you.
Vinita
Thank
madam,
you
Rita
very
Bakshi
much.
madam, Monica, Randi. Thank you very much for giving this opportunity. Thank you.
Thank you, Dr. Jyoti Banglowala, and nobody could have done more justice to the talk than you. You have given us fresh food for thought, raised a few controversial points, and this is, as you truly said, an evolving topic. I think every 6 months you will add few slides, you will delete a few slides, add fresh cases, and I think I predict, you are two law people here, that I predict that in the next 3, 4, 5 years, ART law of India will come up with posthumous preservation, cryopreservation, posthumous, that what will happen to posthumous cases where semen and embryos and eggs are there and the person is not there. How will they all be wasted, or will they be distributed for research, or can they be used in a better way for the benefit of the family? So thank you so much. We'll keep thinking
Thank
about
you.
this, and we'll
Thank
keep coming to you, Dr. Jyoti, for more inputs. And that brings us to the session number 3 with Ankita and Payal. So they are going to start the panel discussion for us. Thank you so much, Dr. Jyoti.
thank you.
Thank you, all chairpersons.
Good evening. Good evening, everyone. After the brainstorming session on gamete freezing, now we come to our another interesting panel discussion. And the topic for our discussion would be role of state surrogacy board. All you want to know regarding surrogacy through state board. So for this, I would like to introduce and invite our moderators, Dr. Monica Singh ma'am and Dr. Randhir Singh sir. As they have been introduced previously, so I would request Dr. Ankita to introduce and invite our experts for the session.
We have great experts for the session, Dr. R.G. Patel sir and Dr. Dharmesh Kapadia sir. First of all, I'll introduce Dr. R.G. Patel sir. Sir is an expert member of Central Board of ART and Surrogacy Regulation Act. Sir is a senior gynecologist and IVF specialist from Ahmedabad. He is director at Sunflower Infertility and IVF Center and has an experience of over 22 years and has delivered over 20,000 live births from IVF, ICSI, and ovum donation procedures. We are truly honored to have you here, sir. Such an esteemed faculty with us for joining this webinar. Thank you, sir. Next, I would like to introduce Dr. Dharmesh Kapadia, sir. Sir is an IVF specialist and senior embryologist from Ahmedabad. He is known for his work at Pratham IVF, and he has his award on Champion of ISAR Award from the ISAR from this his contribution in the field of ART. He also has an experience as a geneticist. We feel privileged to have you, sir, here today in this webinar. Thank you for joining us. Next, we have a galaxy of panelists with us, starting with Dr. Akanksha.
Dr. Akanksha Sharma, she is a consultant at Cloud9 Hospital from Amritsar. We welcome you, ma'am.
Dr. Anit Kumar VM, sir. Sir is from West Tambaram. He is a director at Promise Fertility Center. We welcome you, sir.
Next, we have Dr. Ankita Srivastav, ma'am. She is a keen academician and a fertility specialist from Kochi, and she's been awarded various prizes, and she has been awarded the Young Gynecologist Award and Best Paper Award in 2023. I welcome you, ma'am.
Next, we have Dr. Ashita Dubey. She is a talented gynecologist from Jabalpur. She has many awards to her accolade, and she has been a faculty and various. Hello, ma'am, am I
You're
audible
audible,
there?
Ankita. Yes, you are audible.
Okay. We welcome Dr. Ashita. She is a consultant working at Shishu Mangal Hospital, Jabalpur, and associate consultant at Ideal Fertility and Genetic Center. Welcome, Dr. Ashita.
We welcome Dr. Aswati S. Ma'am. She has also a fellowship in sexology, and she's presently working as a senior consultant in Gokulam Medical College, Trivandrum. We welcome you, ma'am.
Next, we have Dr. Avani Agarwal. Madam is working at Infertility Center and in the field of endoscopy and high-risk obstetrics in Pune currently. And ma'am is also has been in various prestigious institutes and she has been a recipient of various prestigious awards.
Next is Dr. Deepika Arora, ma'am. She's a fertility specialist joining from Panchkula. We welcome you, ma'am.
Next is Dr. Hina Agarwal. She is an infertility specialist from Indore. We welcome you, ma'am.
Our next panelist is Dr. Jatinder Chadha, ma'am. She's a consultant IVF and laparoscopy unit from Srijan IVF and Infertility Research Center from Haryana. We welcome you, ma'am. And she is also a natural coordinator for pre-Congress workshop on hysteroscopy ISAR Gurugram. And she has been the organizer for the first live operative workshop on endoscopy in infertility in Yamunanagar. Welcome, Jatinder, ma'am.
Next, we have Dr. Meenal Chitgupkar, ma'am. She is a director at Dr. Chitgupkar Hospital, Private Limited, Solapur. She is a senior infertility and IVF specialist at Solapur. She has an experience of over 15 years. We welcome you, ma'am.
Next, we have Dr. Sanjeev Maheshwari, sir. He's presently at Jindal IVF Chandigarh, and he's the IVF lab director. He's a certified clinician embryologist. He's an IFS and ESHRE certified clinical embryologist with a vast years of experience in embryology. We welcome you, sir.
Thank you, madam. Good evening.
Next, we have Dr. Simi Maheshwari. Madam is the chief embryologist currently working at Chandigarh. She has been a co-author in various papers and posters and at various prestigious conferences. We welcome you, ma'am. We are delighted to have such a galaxy of panelists with us, and we look forward to an engaging and an enriching experience with the panelists. We welcome you all.
Thank you, Ankita.
Handing over to Dr. Monica, ma'am, and Dr. Radhir Singh, sir.
Thank you
Thank
so
you. Thank
much.
you.
Thank you so much, dear Ankita and Payal. And I acknowledge all the hard work done by coordinators, getting the panelists together, getting the CVs. And my hello to Dr. Jatinder. Jatinder and I, we are batchmates from
Hi, Monica.
So hi, Jatinder. It's always so nice to talk to you and have you
Yeah,
in the program. And
same
Jatinder
here,
is one
and
of the revolutionary persons, She's my batchmate, and she always used to have that, wo jo krantikari ideas. So I think you're going to put some kranti into the panel
Yeah.
today. And I also acknowledge the presence of senior Isarians, Dr. Sanjeev Maheshwari sir, Dr. Simi madam, in the panel, and you have been included because you will give us some very fine ideas to work on in this panel. I'll start sharing my slides. So this panel we did in and it was very well received. With the grace of God, Dr. Randhir and myself, both of us are in the state ART and Surrogacy Board of the state of Madhya Pradesh. So, because of that, we have undergone some training and also come across few cases which are interesting as far as clinical practice is concerned. So, these cases are being taken under the aegis of the new ART Act, and whatever amendments were made in it after being put forward in front of us in 21, it subsequently underwent amendments in 22, 23, 24. The surrogacy bill came out, which was then called the surrogacy law, and ultimately started being called the surrogacy rules. So why so many changes were brought about is testimony to the fact that there was something lacking. So Dr. Randhir has told us in the previous talk, where Dr. Jyoti concluded her deliberation, that ये law थोड़ा जल्दी में बना है. जल्दी में बना है तो there is, it's actually an extraordinary law which was published in the extraordinary portion of the Gazette of India. And you can see the law was formulated on December 2021, and that is when all the practice changed. And finally, we have the final version of it, which has come forward in March 2023. Now, I would start my question to the panelists, that what is surrogacy and how do you define surrogacy as of today? Anybody can take any question. You
Yeah.
please feel free to answer, and this is going to be something like a general discussion.
Surrogacy is where one woman intends to bear the child for a couple, and in no way she basically donates her eggs for that, or imparts her eggs for that. So it is basically bearing a child for another couple. That is surrogacy.
So this is modern surrogacy, which you are saying, Dr. Jatinder. What was
Mm.
traditional surrogacy? You must have seen a movie where, a surrogate mother is coming into the home
Where,
along with the wife,
yeah,
that
yeah,
is
yeah,
traditional surrogacy. So can you tell our youngsters what was traditional surrogacy and how has it
yeah.
changed today?
Where what we have seen in movies basically is lady will come and sleep with the husband of the couple who is intending to have a child, and then they'll have physical relation, and then the child born out of it will be handed over after delivery to the uh, couple, to the wife. Basically, wife has got some problem, she cannot bear the child. So this is a scenario. This is a scenario which was the traditional surrogacy. But this surrogacy, what we are practicing today, here there is no involvement of any physical relationship, and it is the eggs taken out from the women and the sperms taken out from the husband, which was initial part of the act. Embryos are formed in the IVF, and these embryos, and we form a lining, endometrial lining in the surrogate, and we then transfer the embryo to the female who is the surrogate, and then after 9 months, when the baby is born, it is handed over to the couple. That is the
Absolutely,
difference.
absolutely right, Jatinder. So,
So, madam, basic difference remains the source of gamete. In
yes,
the traditional, what you were talking, probably egg will always belong to the
Yes,
surrogate mother. So no
yes.
more we can say that she was surrogate. Actually, basically, you may say second wife. I would like to say
Mhm.
traditionally, if child is being handed over, it does not mean that she was not the second wife. So now, so in this so-called modern surrogacy, particularly even as per the act, the eggs belong to the intending couple. The meat belongs to the intending couple.
yes,
And there is
absolutely.
no, as such, no adultery also, because it's only one, the ethics of a family are being maintained.
And
Truly.
you are
Hmm.
using ART. You are using
Yeah, you're
ART
using ART
technology
here.
in order
Hmm.
to do the procedures. So there
Hmm.
is no scope of any, any adultery or anything like
Yeah.
that. is pure cut scientific procedures. But
Hmm.
I would like to know from our expert, Dr. R.G. Patel sir, if he's there, and Dr. Dharmesh, if he's there, how come this original Surrogacy Regulation Act of 2021, it was turned into rules? Surrogacy rules started being called in 2022. Why was the need to convert the act into rules? Sir, is there? Dr. Randir, would you like to put some light on this?
Yeah, before that, I'll tell you very well told Dr. Sanjeev sir that actually जो movie में होता था that was not a reality, but for youngsters they should know because I have practicing last 25 years and 20 years back, Dr. Monica, if you remember, one retired justice from Gwalior came to me for surrogacy, and being a intellectual and respected person, I offered him coffee, and then after 15 minutes to half an hour, everything was done. Then I told, yeah, surrogacy के लिए आप fit हैं, सब है, uterus है. Then आखिरी में बोले, सर वो सरोगेट हमारे पास घर पे कब आएगी रहने के लिए? See, so this is a knowledge, little knowledge. So what? So I think the youngsters should know that traditional surrogacy was never legalized, even in
In those
past 10,
times.
20 years also. So this surrogacy rules was there because surrogacy, अब अगर आप history में जाएंगे detail why it has come in the rules, you know everywhere that India अभी भी हमारा medical tourism है. What IVF we are doing in 1 to 2 lakhs is 20 times more costlier in other countries, especially in the Western countries, USA and all. So surrogacy was also in India. You used to get it at very affordable rates, and it was the centers. They were doing a very good job, and the poor ladies, uh, they were not manhandled by any agent and all. But the perception of the government, because of media and press, they got it that there is some agent behind the surrogacy chain, and the surrogate mother is being cheated, or she has been, उसको बोलते हैं कि उनको एक, they were not given the proper compensation, and there was some system which doesn't have any rules. So it's like driving a car, because there, I don't know any in the world there's a country where you cannot drive, you can drive without driving license. So they wanted a legislation that if you're doing a surrogacy indication, proper things should be there, and it was a need. I will consider there was a need because आपने देखा होगा जापान के and all, I will not name any center, but पूरे world के surrogacy people, they used to come to India. So if the lot of sudden inputs will be there, I think law has to become, and law आने के बाद it has been legalized, but only the problem is that will come in the coming 1 hour, that it's not no so easy. Legalize हो गया है, but it's not so easy. Yeah, Dr. Monica.
Yeah, so that brings us to the Surrogacy Act and rules and the difference between traditional surrogacy and modern surrogacy. Now, I would like to ask from our panelist, Ankita Srivastav, that what is, because she's doing MCH in reproductive medicine, I was very impressed, a very brilliant panelist we have. So, if you want to start after your MCH, you want to start your IVF center along with surrogacy. How will you proceed, Dr. Ankita? And will you require further training after MCH?
Ma'am, the law says that 3 years of experience along with MCH or FNB and 50 oocyte pickups are the requirement. And ma'am, after that, we have to register the surrogacy clinic. The IVF clinic as well as the surrogacy clinic have to be registered. And we have to renew the registration every 5 years. And this has to be a amount of 2 lakh rupees we have to do, which is which cannot be given back. And if it is refused, then we have to reapply within the next 60 to 90 days. And then we can apply, and it has to be renewed every 5 years. And before at least 60 days of expiry of the registration, it has to be renewed.
Okay, so this means to say, even after finishing your MCH, suppose during your MCH you do not do 50 oocyte retrievals.
Yes,
will
ma'am.
will you need further training after that?
Ma'am, as per what is written in the law, it says at least 3 years of experience. So that is a gray zone because in the 3 years, we are usually completing our 50 oocyte retrievals. And this is a gray zone because the law specifically mentions that at least 3 years, which we have completed.
Okay, okay.
Dr. Ankita, I'll put a little more detailed discussion here. First, I'll go to the registration part. Registration part, 5 years is for IVF, ART1, ART2, and ART bank. But for surrogacy, it's only for 3 years. It has to be renewed every 3 years. So that correction. And now, because Madhya Pradesh, West Bengal, we have already crossed 3 years more. And we have got registered in October. Now it has come to 3 years finished. So we applied to the central government and they have come with a notification that we are in the process of a renewal process because fees has to be important. Because like in PCP and DT, it is 35,000 for first time. And when you renew every 5 years, it is half. So we gave suggestion for that. So whatever centers, I think where if you're in the Kerala or anywhere, now the law says that if your center has completed 3 years and it was due for surrogacy, you can continue till the new law comes. So that was part one. Part two, I am coming to the training part. That is 3 year. So 3 year plus the compensation is the 50 OPUs. See, suppose why I'm saying because it's not a gray zone. It's clearly mentioned that the minimum part is 50 oocytes pickup. And that if you do in 3 years, okay. If you have not done in 3 years, you have to take 6 months and all. So I think why I'm saying all the institute who are doing the MCH reproduction, MCH for this reproductive health, I think at least in 3 years they will be doing the 50 OPUs. That's understood.
Okay, so thank you, Dr.
Excuse me, madam. I want to intervene here.
Yes, Dr. Mahesh.
Yes, sir, sure, sir.
But so ART level clinic 2 and surrogacy clinic are doing same work. They are doing ovum pickup, they are doing insemination, they are doing culture, they are doing cryofreezing, and they are ultimately transferring the embryo. Then why we need this surrogacy registration? Surrogacy eligibility, etc., is given by the state board appropriate authority. But why we have to pay the fee again? Since we are doing the same work, suppose we are doing 500 cycles, we were doing 1000 cycle. Fees is same for the ART level 2. Why we are paying extra for the surrogacy clinic? This is what I want to know.
वेरी परफेक्ट क्वेश्चन संजीव सर. इसके लिए आपको लड़ाई लड़नी पड़ेगी, यूनाइटेड होना पड़ेगा इसार फॉक्सी को कि ART 2 ही बेसिस है सरोगेसी के लिए. तो आपने इसको अलग क्यों किया है? इसको आप लड़े सर, पक्का अपन जीतेंगे. वेरी गुड क्वेश्चन, ग्रे जोन, एंड विल फाइट फॉर दैट.
Basically, they think that surrogacy is a higher minting machine because otherwise ART, they know the range is around 2 to 3 lakhs per cycle. But because you are higher, there is a surrogate involved, so definitely the ART clinic must be charging something extra for treating the surrogate. So they think because it is earning so much, why not take from the surrogacy clinics and separate the surrogacy clinics from the level 2 ART clinics so that they can focus on where any malfunction is going among so many ART centers level 2, which are the surrogate clinics, so they can see that whether the rules are being followed properly in those particular centers only. They can focus more on the law part. That is the reason.
Why the center is paying? It is their duty to look at the centers if some unethical is going on.
Yes, they have to maintain. Yes, sir. Because they have to require certain people who will be well trained in surrogacy laws, and then they have to see that whether they are functioning okay. So basically, like they have to hire, they have to form a board, and they have to see the patient correct indication is there. The surrogate is not being maltreated. So a board has to be there. So it is there is definitely a lot of functioning going on at the. I'm not protecting the PNDT or the CMO part, but they will require to hire in the future upcoming areas. They must be requiring to hire some special people for these, and maybe for that they have put up like that. This is my view. I don't know what is it.
Dr. Jitinder, your perfect view is there, but Sanjeev sir has taken a very good point. So Sanjeev sir, मैं इसका ये बताऊंगा. Why this ART has come? नहीं, ART Act has आया क्यों? Dr. Jitinder, आपको I tell you. Late Sushma Swaraj, who was a member of parliament from my MP Vidisha, एक जैसे नोटबंदी स्टार्ट हुई गवर्नमेंट ने, ऐसे सडनली आपको याद होगा बिना कोई एक्ट के सरोगेसी वाज बैंड. रातों रात कल से आप सरोगेसी नहीं करेंगे. तो अगर आप हिस्ट्री में जाएंगे तो एआरटी एक्ट को तो आप भूल जाइए। हम लोग सिर्फ सर, संजीव सर, आप कितने हमसे भी सीनियर हैं सर, सिर्फ हम आईसीएमआर गाइडलाइन फॉलो करते थे। आईसीएमआर गाइडलाइन वेयर नॉट लॉ। तो आईसीएमआर गाइडलाइन में हम फॉलो करते थे। हमको लगा कि आरटी एक्ट आएगा आईसीएमआर गाइडलाइन के साथ, बिकॉज इट वाज 2010, 2010 में आया, फिर 15 में आया। एंड यू रिमेंबर दैट डॉक्टर शर्मा के थ्रू हमने आईसीएमआर रजिस्ट्रेशन भी कराए थे, फॉर्म भरे थे, आपको याद होगा
Yes, sir.
लेकिन रातों रात ये सरोगेसी एक्ट, सरोगेसी को बैन किया, फिर पार्लियामेंट में पास किया, पार्लियामेंट में स्पेशल कमिटी मेंबर बनाए गए। तो व्हाट टेक होम मैसेज इज दैट सरोगेसी को बंद करने के लिए, आई विल नॉट से सरोगेसी बंद, सरोगेसी को ऊपर एक वर्ड आई, एक रेगुलेशन के लिए वो एक्ट लेके आए। तो उनको लगता है कि सरोगेसी को तो एक अलग
बिकॉज
ही
ऑफ द
रखो,
बॉलीवुड
जो
हाइप ऑल्सो
डॉक्टर जितेंद्र आपने पॉइंट किया।
तीन चार बॉलीवुड एक्टर्स एक्ट्रेसेस ने सरोगेसी करने लगे, तो उन्हें लगा कहीं ये ट्रेंड ना स्टार्ट हो जाए अमंग्स द रिच
नहीं डॉक्टर
पीपल।
जितेंद्र, आई टेल यू वेरी परफेक्ट, नहीं ट्रेन नहीं, आई टेल यू, मैं तो सरोगेसी आई स्टार्टेड इन एमपी एंड यूज्ड टू डू अ लॉट ऑफ सरोगेसी। हमारे पास उस जमाने में फोन आने लगे। नोएडा, नोएडा वाज द सिटी ऑफ ऑल प्रेस, टीवी के जितने भी इलेक्ट्रॉनिक मीडिया हैं, वहां से एक फोन आने लगे कि सर ये तो यहाँ ट्रेंड है, अपना एक पहला बच्चा पैदा करो, यू प्रोड्यूस वन योर ओन चाइल्ड एंड यू विल इजीली गेट अ सरोगेट लाइक द फिल्म स्टार हैव गॉट इट। सो आई थिंक विदाउट वेस्टिंग टाइम, सर का पॉइंट लेकिन बहुत अच्छा है डॉक्टर जितेंद्र, आप मंथन करिए कि एआरटी 2 को हम सरोगेसी से क्यों अलग करें। सरोगेसी में कोई ऐसी नई चीज तो है नहीं, सरोगेसी में वही कर रहे हैं
सरोगेसी
जो
में उन्होंने
एआरटी 2
हमें
में कर रहे हैं।
परमिशन देनी है डॉक्टर रणधीर, उन्होंने हमें परमिशन देनी है सिविल
रणधीर
सिविल
रणधीर
हॉस्पिटल
ऐसा ऐसा तो नहीं है, आप ही बात कर रहे हैं ना पास्ट हिस्ट्री, जो डिफेम हुआ इंडिया कहाँ से स्टार्ट हुआ, नॉट बाय एआरटी।
सर आ गए, सर आरजी भाई है, सर है का राइट टाइम, यस सर।
तो वो पुराना याद करो, लोगों ने किया, सरोगसी किया, मे बी एल्ट्रुस्टिक, मे बी कॉमर्शियल, तो वो डिफेम हुआ ना। सबसे ज्यादा डिफेम इसमें ही हुआ है, ये सरोगेट में। तो गवर्नमेंट को तो वही मेन डिफेम थे, इसलिए एआरटी लो ही आया मेन, तो नॉट बिकॉज ऑफ ऑल प्रोसीजर एंड एग डोनेशन। So to regularize, to decrease the misuse, to prevent the defame of the women's poverty, and like India is a poor country and they are misusing the female. To avoid that, they came more about the surrogate, more strict about the surrogacy. So for that regulation, they need separate, maybe registration, separate fee and everything. So that is the logic.
मैं तो सर इसको, आरजी सर, मैं तो हमेशा माइंड में वेर एवर आई गिव अ टॉक ऑन दिस, आई ऑलवेज से दैट रातों रात 2000 के नोट क्यों बंद किया गया, नोटबंदी क्यों किया गया, बिकॉज देयर वाज अ करप्शन, करप्शन हुआ। तो ऐसी दिस इज द सरोगेसी, यू आर राइटली टोल्ड, पॉइंटेड आउट सर।
And I feel my contribution is that, RG sir, that I think surrogacy extra fees is being charged for the centers, level 2 centers who want to register for surrogacy, because of the documentation, counseling, everything involved. You have to give a large part of your working time to that couple. Whether it is, knowing the documentation, knowing the essentiality, knowing the eligibility, sending the surrogate for medical examination, sending her for psychological assessment.
Lots of required.
Scanning the third party insurance, scanning the insurance cover. So the doctor is not doing anything, but doctor has to be responsible that everything is in order. I think that makes up for the chunk of your time.
Separate registration required, yes.
Probably.
Everything, yeah.
So, madam, we need to be more vigilant and all that, and over and above, we have to pay extra fees.
Absolutely. So I think
it is very, very wrong.
Agree that we are doing a lot of extra work when we handle a surrogacy case. It is like so many people are not doing obstetric sonography nowadays. You ask, why are you not doing obstetric scan? भाई बहुत
संजीव जी अभी तो लो आ गया, 3 साल हो गया है. If you see the record of their surrogacy, how many are they doing altruistic in spite of this law?
Just sir, how can you imagine this non-commercial?
We are taking
if any authority is ready to close their eyes, we cannot stop that.
That's right, but in spite of this strict law, people are doing.
Yes.
बट संजीव सर ड्राइविंग लाइसेंस है आपके पास तो आप गाड़ी चला सकते हैं। आपके डॉक्टर ने ड्राइविंग लाइसेंस में सी लगा के दिया है कि इसको कलर ब्लाइंडनेस नहीं है, उसको कलर ब्लाइंडनेस है, तो वही चीज हो रहा है सर।
Yes, sir.
So, India, the laws are made to manipulate. So, this is happening again and again. So, this we will be discussing in the cases also. But this is the original Surrogacy Act of 2021. You can go through it and see the amendment. Because if you read the original act, you will be able to decipher what regulations were amended. So you can see chapter 1 is just the definition, chapter 2 is prohibition regulation, chapter 3 is again the details and rights and regulations, prohibitions. Then we have chapter 4 dealing with registration process, which was just alluded to us by Ankita. Then we have the chapter 5, which deals with the constitution of the board, what is the office made up of, what is the state board made up of, how many members are there, what disqualifies you, what qualifies you, and what is the purpose of the board. And then we have other sections like section 6, which deals with appropriate authority. Who appoints the appropriate authority, which is the district appropriate, which is the state appropriate authority, and what are their functions. And then finally, we have the chapter 7, which is dealing with offenses and penalties. And it is important to note that these all these offenses are cognizable, they are non-bailable, and they are there is one more term, non-compoundable. Like these offenses which are made in the Surrogacy Act, if this person or this center is caught, they cannot be negotiated by mutual party agreement. I think Dr. R.G. Patel sir
Yes,
will
yes,
clarify
yes,
that.
rightly say. It's like a
Yes.
triple murder,
Yes.
like a terrorist.
So till you are
Non-bailable,
doing, yes.
non-compoundable.
Yeah. So till you are doing it, it is okay. You are
There is no, you cannot compensate with money, finance, directly jail, here in the
Yes.
bar. The
And
law
sir,
make like this.
yes, and I think doctor का तो sir, when the doctor commits a mistake or a crime knowingly or unknowingly, उसका पूरा career जाता है. So this we have to really see, you know, take it with a pinch of salt when we do surrogacy, that we have to take it very seriously, and that is why I think we are paying an extra fees. So now we come to question number 1, clinical question to Dr. Simi is there?
Yeah, Dr.
So,
Monica, before this, these questions
yeah.
have been based, sir, RG sir, these questions we have based that we are in 3 years, we have cleared many surrogacy cases. So, हमने उनको एक hypothetical cases बना के practical में रखा है. So, they are very useful tips. Yeah. So, Dr.
So
Monica,
a
okay.
couple, an intending couple comes to a gynecologist for checkup of a potential surrogate mother. We know all surrogacy on Indian soil has to be altruistic surrogacy. So this is a proper couple, intending couple who feel that they are right for surrogacy. They go to an IVF center, they select a potential surrogate mother in another town who is related to them. Now the hospital they go to, is there any registration requirement for that clinic, hospital or gynecologist to do examination of the surrogate along with pap smear and other tests?
No.
Can any hospital do?
Any hospital
Yes.
can do. No require registration.
Yes. So even a non-ART registered clinic and hospital can do a complete gynecological examination and report that in their files as far as the surrogate which is brought to them is concerned.
There is Form 19 in the Act, which is for screening of surrogate mother.
Yes. And now a couple comes, they go to a proper surrogacy center, and this surrogate she conceives in the second attempt. Now, can any of my esteemed panelists tell me how many attempts can you do on one surrogate of embryo transfer?
3.
3. So if the
Not more than 3.
Not more than 3. And how many embryos can be transferred? You know, all Surrogacy Act has to be 100% IVF.
Madam, there is a gap.
One, preferably
Only one.
Single
Madam,
embryo
they
transfer.
say,
in certain conditions.
Single embryo transfer, mostly in certain special conditions, we can transfer up to 3.
Up to 3.
So can you tell me which are the special circumstances where you can allow 3 embryos to be transferred for surrogacy?
First,
All that I will say, poor quality embryo.
Poor quality embryo, yes, sir.
You can say you can transfer it.
Or you can add a day 3 or day 2 embryos.
Day 2, day 3 doesn't make indication for 3 embryos to be transferred.
No,
In fact,
if
it will
the
give you
patient has had 2 failures, like it is a third chance, you may go for a 3 embryo
yes,
transfer.
who
yes,
failed, huh?
yes. If every time the surrogate lines up with a thin endometrium,
Mm.
which is not growing beyond 6.57 mm, then probably you can request for a 2 embryo or a 3 embryo transfer.
Mm.
So,
Dr. Jitinder, I'll go in detail. You told that repeated IVF failure. So here we are doing talking about the surrogacy.
Yeah,
So
yeah,
you
yeah.
are saying that of
Not
same
IVF
surrogate.
means 2 transfers you have done, and this is the
Previous
third chance.
2
You
failed.
can have 3 chances. No?
Previous 2 failed.
No, failed of the same surrogate mother or different?
The
same
surrogate.
same surrogate.
No,
We're
sir,
just talking
same
about
surrogate. If you
So
have to
same
go for
surrogate.
this,
So same surrogate.
Yeah.
Yeah.
First time she underwent one single embryo transfer, she failed.
Second.
Then
Allowed
second time also
because
she
this we
failed. But third time you can do 2 or 3 embryo transfer.
Yeah,
Yes,
this is
sir.
what I meant.
Yes, I think that will be a valid indication. Now, very interesting discussion we had in a previous webinar. Now, this patient is coming for antenatal care, and she is in a hospital, which is a non-IVF hospital, and she has come for antenatal care. What name? She's a surrogate mother, and she has come alone to that hospital. She's carrying no records. How will the file be made? How will she be admitted? In one scenario, she has disclosed she's a surrogate mother. In another scenario, she has not disclosed she's a surrogate mother. And now she goes into labor. How will the birth certificate be made? What will be the names on the file? What will be the names on the birth certificate? Can anybody elaborate?
If she goes to okay. Yes, sir.
if she has disclosed that she is a surrogate, she has a agreement with the intending couple, then file will be made in the name of the intending couple, and on the birth certificate it will be the intending couple's name. But if she is not telling, probably she is guilty for all the things, because
Now
she is supposed to tell.
No, actually the patient's name has to be on the file, the medical records.
Yes.
So even if the surrogate goes without her intending couple or goes with her intending couple to the hospital to get admitted, the name will be the name of the
surrogate.
surrogate.
Yes, it is very, very important.
But there was a extensive discussion, RG sir, in the previous
Yes, but
webinar.
that is the fault of surrogate. That is a breach of confidence between this intending couple, and this is a fault of surrogate mother.
Yes, sir.
They can punishable.
Yes, sir. But sir, now in another situation, the surrogate has gone for admission to a hospital with labor pains along with the intending couple.
Then it's okay.
Then what will be the name? How will the name be
Name
mentioned on the file?
an intending couple.
Sir, no name of the surrogate will be there
No,
on the
no,
file?
no need, no need, no
Nay,
need. No surrogate,
I
nothing.
differ here. I differ here, Monica. What happens is a patient in labor may have certain complications for which her consent and her husband's consent may be needed. And definitely the patient's name, because what we are is this is the ART law, but if it is the right to give a consent for anything, so she stands there that she can give a consent for herself if she's suffering from some complication. Maybe the intending couple doesn't give the consent for that, so her name and her husband's name should be there, and you can write it in bracket, she's a surrogate for so and so couple. They can pay for it, they can do everything, but for any procedure on her body, she is responsible and her consent needs to be taken. How we can take the consent if her name is not written on the file? So this is very important.
That is what was discussed last webinar also, Jatinder, and we came to the conclusion that the file will have the name of the surrogate mother.
Surrogate, yes.
And if you want to be very particular, you can write she is surrogate for so and so. But if confidentiality is required, you don't want to publicize that case in front of your hospital staff or something, you can just write the name of the surrogate. And not
Mm.
mention anything, but the hospital record will know that she is carrying a baby through surrogacy
Okay.
or
Yeah.
she is surrogating for somebody. So that is the conclusion we came to in the previous discussion. And coming back to
But madam, birth registration will be only in the intending couple's name.
yes, always the birth certificate has to be made with the name of the intending couple. As soon as the embryos are transferred, and the surrogate becomes pregnant, the surrogate loses and relinquishes all right over the progeny as well as the embryo, the fetus, and finally the baby. So that is there in the contract. The surrogate has no right. It is the baby of the intending couple only. So
Here, Dr. Monica, I'll just make a clarity for all the panelists and all the viewers that till 9 months till delivery, the patient's name will be the everywhere admission will be the surrogate name. But at the time of birth only, she will not get the birth certificate of her name.
yes, yes. So this is what we have discussed. This is the same question. Any qualified gynecologist and a suitable hospital can deal with emergent obstetric or medical situation and conduct the delivery of the surrogate. You have to maintain proper antenatal records stating the surrogacy details and the insurance details also. Because so many hospitals are now, undergoing third-party insurance and everything. So the birth certificate will also carry the name of the intending mother, and you can specify that baby is born through surrogacy, but this again came under controversy, Dr. Randhir, last time, because whether the baby born through surrogacy should be written on the birth certificate, it should not be written, because that will create a stigma when the baby takes that certificate to the school
Admission.
for admission and all that. Now coming
No,
to
no. But Dr.
overseas.
Monica,
Yes.
the law never says that the reality has to be hidden by anyone. So it's I think the right of this is a act. I think Dr. RG भाई और legal अभी अगर MC पटेल सर होंगे तो हमको इसका review मिलना चाहिए. I think there is
A
no harm in
child,
writing on the birth certificate.
the
Yeah, कि through surrogacy हुआ है.
No, the
Sir, there is
Dr. Ranveer sir, I would like to have a comment here. Basically, a child can know what is the mode of her or his conception after the age of 18 years, not prior to
Yes.
that. So they should not be disclosed to a child because it may cause a lot of mental trauma and psychological factors may arise. So if a baby is born through ART, a baby has the right after 18 years to know what was the procedure or something, but not prior to that. If the birth certificate is written, the teachers, anyone, then you have let loose the information. So I think
The birth,
confidentiality is a part
yes,
here.
yes, birth
नहीं
certificate
इस पे
should be at the.
I'm not agreeing. No, I'm not agreeing. RG भाई sir, do you have all this act on that?
But Dr. Randhir, there is no such column that how the child was born through surrogacy or not. There is no such
And
a
there's no
point.
need. There's no
No,
And
need
there
to
is
no.
write.
There is
and
no
they
need.
No,
they
There is
no,
no
never
need.
there is
even
no
they
need.
don't ask.
No. I'm not asking no need, sir. Suppose the patient wants and the intending couple want that. Please write a word on this born through surrogacy. It's a reverse question.
No,
If they
sir.
are asking,
Sir,
are
intending
we
couple
in
will never.
condition that will not write?
Intending couple
You
will
have to
never
take a
ask.
consent.
They will,
You
they
should
will
take the
never, they
consent
will
from the
never
Yeah,
parents.
ask.
You should take the
sir. Fair.
consent from the parents that they want that it should be written,
Yeah,
but
yeah. So
no
Sir,
parent
therefore,
will
वही.
require it.
So yeah.
sir,
Legally वो मांग सकते हैं हमसे.
हाँ.
sir, even on birth certificate, mode of delivery is not written.
Yes.
So born through whom it is. Why we are creating confusion?
Unnecessary.
There is no,
नहीं
there is
लेकिन
confusion
सर
in
देखिए
it.
देखिए सर बर्थ सर्टिफिकेट ठीक है हम रूटीन बनाते हैं बट इफ द पेशेंट डिमांड्स अ डिटेल ऑफ द बर्थ सर्टिफिकेट आई थिंक इट्स अ लीगल
Patient will never
डॉक्यूमेंट
demand. Dr.
वो
Ranjit,
हाँ
let me
इट्स
come
अगेन अ
to
ग्रे जोन
discussion.
या अगेन अ ग्रे जोन
Because see, no intending parent would like
Will
to
require.
get that written on the birth certificate. I
They
mean, we
don't
can
want even
imagine
IVF.
their
They
mental
don't even
condition.
want IVF to be mentioned anywhere.
But yeah,
My
Jatinder
patient.
is right that every child has a right to know what was his mode of conception or her mode of conception, whether it is adoption, whether it is a surrogacy, whether it was an egg donation. The child has the right to know. And nowadays, it is necessary even to reveal the identity of the oocyte donor.
Yes.
That is another thing. Now, coming to foreigners, and not pure foreigners, here we are talking about foreigners who have got an Indian passport. That is the overseas citizens of India and NRI couples. How can they avail surrogacy in India comfortably? What are the requirements? What are the legal papers? Anybody can specify? Ankita, are you there?
We can.
Ankita must be studying a lot for her MCH course.
Overseas Indian citizens are allowed to avail surrogacy, and the foreigners who are not Indians, they cannot avail, but the overseas citizens of India, they can avail, ma'am.
Okay, so the overseas citizens of India can avail this service, and they, by the law of the land, they are both the husband and wife are Indian passport holders, and these regulations have been specified by the Ministry of Home Affairs and put down in the Surrogacy Regulation Act of 2021. Now, other foreigners who do not have an Indian passport, that is the reason the Surrogacy Act came about, because lot of foreigners were coming to India for, economical surrogacy services. So a lot of commercial activity was being done in that nature. That is why, in order to come to the clause of altruistic surrogacy and to save the interest of these women who were becoming surrogate, this law and regulation was there. Now, what about the monetary transaction? And a lot yeah. Now, the monetary compensation part, what all charges can be given, what all money can be given to the surrogate mother during her process of surrogacy, and what all type of compensation financial is absolutely not allowed. Can you please specify?
Only the working day loss can be compensated.
And the
Work day
medical
loss.
expenses.
Medical
And the medical
And the
expenses.
expenses.
medical, that has to be
Medical
done.
And
expenses.
Okay.
insurance.
Plus
And the
insurance.
insurance must
Insurance
be
of
bought for a period of
36 months. 36
Okay.
months. 3
And
years.
how do you select that insurance agency?
That has been specified, I think, by the government. All.
Yes. So there is a
Then
proper
They're
recommendation.
provided what all to be
Yes.
given.
You have to buy the insurance, and how much long or what duration should be the insurance cover?
3 years.
36
In-
3
months.
years.
36 months. And that reason,
life insurance up to 2 years and
Hmm?
medical insurance up to 3 years.
Okay, and, basically, insurance cover up to 3 years. But one thing is missing. What should be the amount of compensation? What would be the how much? 2 lakh, 4 lakh, 10 lakh, 20 lakh. So what is the insurance company is going to pay for medical expenses, if
10 lakhs,
at all
minimum
required?
10 lakhs, minimum 10 lakhs is there.
Insurance is
This
of 2
this
lakhs.
this was discussed in our state surrogacy board. 4 applications came to the Madhya Pradesh Surrogacy Board recently, and we all were there. And what happened was that out of these 4 applications, only one had an insurance cover of 10 lakhs. One of them had an insurance of 2 lakhs, papers complete. One had 3 lakhs, one had 5 lakhs. So the cases were all clear except for one. So these incomplete applications with incomplete insurance cover were sent back, and an extended insurance cover was asked from those intending couple. But
Dr. Monica, here I'll just give you a break. That's as per the act, it is only 3 to 5 lakhs. In our Madhya Pradesh state, we have passed this to 10 lakhs because individual state has got a right to change it, amend it. But as the central act, it is only 3 to 5 lakhs. That's all.
okay, but in
Sir,
Madhya Pradesh it is 10 lakhs.
Yes, sir. Yes, sir. Sanjeev sir, कुछ बोल रहे हैं आप?
sir, in case insurance amount is exhausted, who will pay the rest amount?
कुछ नहीं सर, कुछ नहीं, लॉ में कुछ नहीं बताया सर.
Law पे कुछ नहीं है.
Again a
Yes,
gray
yes.
zone. Again a
Again,
gray
it-
zone.
इसीलिए मैंने बिकॉज बीइंग अ गुड रेपो विद द स्टेट बोर्ड, मैंने खुद मंत्री जी को बोला, मैं कहा सर आप एक आईसीयू में कोई अगर 9 मंथ्स की प्रेगनेंसी है, अगर 10 दिन भी आईसीयू में एडमिट होगा तो बिल कितना बनेगा? बोला डॉक्टर साहब एक तो बहुत बन जाएगा. मैं कहा सर कम से कम 10 लाख तो करिए. तो फिर वहां से सर बड़ी चीजें होती नेगेटिव सर. वहां से जो हम बिकॉज द बोर्ड कंसिस्ट ऑफ मेनी एलईडी एमएलए आल्सो. सो उन्होंने कहा डॉक्टर साहब ये गरीब महिलाएं हैं जिनके बच्चे नहीं है, निसंतान है, आप उनके खिलाफ जा रहे हैं, बड़ी मुश्किल से आईवीएफ का खर्चा इकट्ठा कर रहे हैं और आप इंश्योरेंस का पैसा ले रहे हैं. मैंने कहा मैडम
Sir,
5 लाख और 10 लाख इंश्योरेंस के प्रीमियम में मुश्किल से मैडम 10 से 5,000 का अंतर आएगा।
रणधीर, इंश्योरेंस तो ओके, कोई अमाउंट भी फिक्स नहीं है लो में।
है सर, शायद है सर।
डेलिबरेटरी हमने रखा है,
हाँ
समय
नहीं लेकिन
टाइम
बट सर स्टेट ART बट स्टेट बोर्ड कैन पास दैट सर।
आफ्टर 10 lakhs intending couple is the responsible.
सर ऐसा कहीं लॉ में नहीं है सर, ग्रे जोन देखिएगा सर।
है बट एवरीथिंग लो तो क्या है, उसको प्रोटेक्ट करने के लिए इन
हाँ।
बिटवीन फैसिलिटी है। द प्रोसीजर इज डूइंग फॉर द इंटेंडिंग कपल। तो जो एक कुछ भी होता है सरोगेट मदर को, तो ऑल रिस्पॉन्सिबिलिटी मे बी 50 lakh, मे बी 1 CR responsibility is intending couple.
If they do not pay, how are you going to extract money later on, na?
नहीं पे करेगा, आईसीयू में से वो डिस्चार्ज नहीं करेंगे, कॉर्पोरेट तो लेके ही रहेगा, तो डॉक्टर को पे करना पड़ेगा। पेशेंट कहाँ से पे? सरोगेट तो पे करेगी नहीं।
इसीलिए डॉक्टर रणधीर is saying na that the amount should be increased.
हाँ या तो
How does it matter if they are they're using somebody's body? They can make an insurance because insurance company will pay na later on.
1 minute.
सर क्या
1 minute.
सर क्या
रणधीर, MP is different, Bhopal is different, Bombay is different, Bangalore is different, Delhi is different. That all depend on the situation. मेडिकल साइंस कितना महंगा है, इसके आधारित उनका इंश्योरेंस लेना चाहिए।
Yes, sir. So that is noted. The insurance part is noted. That is, I think every state is deciding, and the state board, which is consisting of IVF specialists, can give their recommendation. And if your bureaucrats and politicians, they listen, then you can probably give a recommendation in favor of the surrogate mother who is doing it altruistically. Now, earlier, Dr. R.G. Patel sir is there. In 2023, it was given, it was a very controversial statement that both the gametes of the intending couple needed to be taken from the wife and the husband only. Donor gametes were not allowed when the surrogacy rules came in 2023. And similarly, if it is a single previously married woman, divorcee or widow undergoing surrogacy, she had to use self eggs and donor sperm to avail surrogacy. Now, Dr. Jatinder, Dr. Maheshwari, Dr. Ankita, and everyone who's there, please tell me what changes have been made in this important clause in 2024.
Yes, self eggs have been avoided. Now they can, if they cannot provide self eggs, then they can go with the donor eggs in both the conditions.
Both sperm and eggs.
No sperms, only eggs.
No,
Only
no,
eggs.
madam.
If there's a single woman, she cannot procure her own eggs. If like she's AMH is low or her age has passed, so she can procure donor eggs for that.
And there was a case for MRKH syndrome was there, and she didn't have a uterus,
That
and she was
amendment.
give eggs. So that is when it was proposed. It was challenged, and it was proposed in Feb 2024. The amendment came that at least one gamete should be from the couple.
Yes, one gamete from outside they can take instead of both gamete from the couple.
But if it is a single woman,
She
remember
can
a single
Then one egg, only egg, own egg, not
Then
illegally allowed.
she must have her own egg.
Divorcee,
Oh yeah.
not allowed.
Wait. A single woman, the sperm she can take from out, but eggs have to be her own. I think I was mistaken there. Yeah.
Again, a gray zone. Suppose a woman is infertile and she has been trying to conceive, she has not conceived. She loses her husband at a particular age, 35, 36. That time her AMH is 0.1 or 0.2. Her self eggs are not good. Then even with this law, she is not allowed to undergo surrogacy because she will not have her own eggs.
Yes.
So this is a gray zone. This is a gray zone. You know,
Madam,
they have allowed single woman, but that woman should be previously married. It cannot be a single unmarried woman.
Unmarried.
She has to undergo marriage even if it is for 1 year.
Unmarried is not allowed for the surrogacy. It's a clear law.
Yes.
Once she married, become divorced or widow, she can surrogacy.
And what about single men, Dr.
Not
allowed.
Not allowed.
Because of so
one
many.
thing more, madam.
Yes.
When you allow the one gamete to be taken from them, even then, that is to be decided by a board, medical board. That patient is unable to produce the gamete, whether it is an egg, whether it is, but it is to be decided by a board, not by a simple
Not the
simple
gynecologist.
gynecologist.
So as you can read, Dr. Maheshwari, when the district medical board certifies that either
Yes,
husband or wife
yes,
constituting the
yes,
intending couple suffers from a medical condition necessitating the use of donor gamete, only then
yes,
surrogacy using donor gamete is allowed.
Yes.
Subject
yes,
condition that child to be born through surrogacy must have at least one gamete from intending couple.
yes.
Yes.
That is the only genetic link should be there.
Yes, because if you have both the gametes from outside, then the couple might as well adopt a baby. Why are they undergoing
Yes,
surrogacy?
yes, madam.
Why are they not adopting? We have to
Yes,
promote
madam.
adoption also. The law has taken into consideration that why don't you adopt? Just now, I worked up a couple for surrogacy, and there were lots of papers, lots of meetings, and then they disappeared for 6 months. So we were discussing that maybe now they have changed their mind. After 6 months, they came with a big mithai ka dabba and a baby girl. They came to know, and Jatinder, that patient was from Jind, Haryana. They had just come to know that a third daughter had been born in one of the ladies' Maikewala side, and they were going to give that third daughter away. I don't know what they were doing. These people rushed and they adopted the girl child and they came to know.
Always welcome. It's always welcome.
Yes, yes. So,
Only it
this
is
is
because adoption rules have been so stringent and the boards they do not pass. I have had couples who had lined up in Chandigarh for adoption. At the age of 6 months, they see a child, and till the time the formalities are completed, the child is already 12 years or so. So it is so long it takes for adoption. Otherwise, it is much better an option for all these
yes.
parents.
So now just a theoretical question. Ankita, can you tell us the age of the surrogate mother, the age of the intending couple, husband and wife? What should be the age limit?
Ma'am, it will depend on whether she is like the intending couple. We will see it will be 23 to 50 years for the female and
Yes.
26 to 55 years for the male. And for the person who wants to be a surrogate, that age limit is 25 to 35 years for a surrogate mother. If in case a widowed or divorced woman wants to avail surrogacy when she's using her own eggs, then the age limit is 35 to 45 years.
Okay, so the divorced mother has to wait till the age of 35.
35 to 45, the limit. Yes.
Till she undergoes surrogacy. Can you imagine? And her AMH will go down. Imagine, at 32 years, she became a widow. That time her AMH was 1.5. She has to wait for 3 years more in order to avail surrogacy. And that time her AMH will become 0.2 because she cannot use donor eggs. Again, this is a gray zone. Okay.
So this needs
So there
revision.
are so many gray zones that
Revision.
need some changes. So this is all the, this thing.
Ma'am,
And then
whether she freezes her oocytes at the age of 32, and then if she wishes to use this, will she be able to?
yes, here this is the part that Dr. Jyoti talked to us about. That is the
Yes.
importance of
Egg
knowledge,
freezing, yes.
money, and intention as well as knowledge. Because suppose she is in a tier 2 or tier 3 city where she doesn't have knowledge about this, suddenly she has become widowed at 32, 2-3 years तो वो उस lady को ठिकाने आने में लगेंगे. After the widowhood, what
Widow.
to do, when to do. After 2-3 years, she will realize that I need a baby now. And by the time she will go to surrogacy center, her AMH will go. And it will go because of so many things also, biological conditions, stress, neglect, whatever. So how do you find these surrogates? Like, the oocyte donor. What about the provision of the oocyte donors? The surrogate is definitely not giving her eggs, and this intending couple is only giving the sperm. So who procures the oocyte donor? What is the requirement by the
Just
act?
through the ART bank,
Yes.
you can procure the oocyte donor.
And now RG sir is there. ART Bank is also doing all sorts of now activities which are not in compliance with the act. Just now before this panel, I got a phone from Mumbai that, madam, we are supplying oocyte donors. Now, everybody must be getting phone calls. They are openly ringing up. They have got websites They are advertising and they are giving us the rates on regular phone, not even on WhatsApp call. That this is our rate, this is how we will give HCG, this is how the donors will come to you. So now the terminology has changed from commissioning couple to intending couple. Ankita, why did this change? Any idea why we started calling the commissioning couple intending couple? Hello?
I'm not sure, probably because they have to have certain criteria why they become the intending couple.
No. I think it is more of terminology.
Terminology.
Commissioning is like a business.
Mm.
It's a commissioning. You are doing business with the surrogate. But intending means an intention to have a surrogate, and the surrogate has got intention to give the baby.
Okay.
The proper intention should be there. That is where the terminology has become more soft. It has become more social, and you have stopped using the terminology of
Commissioning couple.
commissioning couple.
I
This is
think,
how
Dr. Monica, the commissioning word is no commission means you are going to a word you have used very word hire. So now that should not be there. No, you cannot hire anybody.
Yeah.
You can be only the patient. The patient, actual patient, and intending couple. Yeah.
Sister?
I think, sir, intending couple do all the things of their own. Commissioning
Yeah.
couple get the things done by so-called commission or money,
Agent,
whatsoever.
agent.
Agent, but any proper word you can fit here.
Yeah.
So these are the list of documents, and these are very, very important. Actually, in our state, in Madhya Pradesh, the ART Act application and the surrogacy rules application was done by a very able team. And we should have to give due respect to them. The National Health Mission was very active. This board was very active, and they came out with documents very nicely. So, Dr. Randhir, can you tell us what all documents are needed, or anybody can go through it? This is a very important paper. You can even take a photograph of it, because any state which is doing surrogacy in the proper way will need these documents in order to take the case forward. So anybody can go through it and tell us.
Basically, we call that
Medical.
essential certificate and eligibility certificate.
Yes, sir.
So
Yes.
when we say eligibility certificate, it includes all the document of your ID, identity, your age, or you are married, you don't have any child. If you have any child, probably that is mentally retarded. These are called eligibility condition. For the surrogate, you need a proper age certificate. You need the birth certificate of his child, that he's already having a baby and he's well, affidavit, that psychological consultation, etc. So these are the certificate, eligibility certificate of the surrogate. Then you need indication of surrogacy from a medical board, whether it is uterine or something systemic problem which will lead to the deterioration of the mother if she conceives. So this is eligibility and essential certificates. This is probably though two major certificate, and further certificates of the sub branches of that conditions.
Yes, sir. So this is nicely elaborated, and I would advise you to go through the requirement of these certificates. Essentiality is different from eligibility. There has to be essentiality and eligibility of the intending couple. There has to be eligibility of the surrogate mother. And when all these documents come together to the board, then they go to the bureaucracy, and then that is when the certificate of recommendation is given to that intending couple, and then the intending couple can go to any surrogacy center of their choice. Now another question, interesting question. Now Jatinder, you have a surrogacy center. They have come to you, you have done all the work, you have taken your fees also, but now they want to go to Delhi NCR to get surrogacy done. Is it allowed?
People who are belonging to a place where the IVF center is, the same city or the state board has to be consulted. Like if we are doing IVF here, then the NCR board cannot pass it. It has to be done it has to be passed by the Haryana board. or the nodal officer here. So it is not here like you pass it here and you get it done the surrogacy at Delhi or somewhere else.
No, that is the catch, Jatinder. I would like to
Hmm.
correct it here that
Mm-hmm.
once you get a certificate of recommendation from any state of India, whether it is MP, it is Andhra
They
Pradesh,
can
it
do
is
it, get it done
Delhi,
anywhere else because I
you can,
consulted my board here.
yeah,
Huh.
you can get the surrogacy done anywhere on Indian soil, wherever there is an authorized surrogacy center in an level 2 IVF center.
It is in the act like that?
Yes, it is in the act because this is again a question we asked, and this
Hmm.
was because we have done it so many times before. We cleared all these doubts. So once
Okay.
the person gets a certificate of recommendation from any state board, all
Huh.
over India, that person, that intending couple can go and they can scan the most suitable clinic. They can go to any center where they feel like, provided that is an authorized surrogate center.
Okay.
Dr. Monica, you have Dr. Jitendra to support this document. Dr. Monica, you have not taken in the PPT that certificate. Now I'll tell
Because
you, Dr. Jitendra,
because
it
we
was
are
in.
in Haryana, we are lagging a lot, and we just got the registrations certificates after 2 years of time has already passed, and now I had
Surrogacy.
surrogate patient
Surrogacy.
and I consulted the there is no board yet to be yet formed. It is to be formed here in Haryana. So, and here one more thing which is going on in Haryana is you must have read in the newspapers if a patient has a prior female
Yeah,
child
IVF.
with for IVF, previous female child,
Yeah,
they
that
have to
we
get the
that
permission.
we yeah.
They have given these notices to few centers and not to all. So we are in a dilemma what to do for these patients.
So I think
No, actually, we had discussed, Dr. Jitendra, at ISAR level.
Hmm.
So I think your state ISAR body also. So we are supporting you because this
Hmm.
cannot be a unique law
Yeah.
from only for
Hmm.
one state. But Dr.
Hmm.
Jitendra, because you are not doing much and your state is behind the act, but to make the give a message to all the viewers of this webinar is that in 23 there was an order. Now who where a surrogate can be registered surrogacy. Why? Because suppose a one state out of 30 state, one state is very lenient. एक भी
Hmm.
IVF फेल हो गया, ठीक से इंडिकेशन भी नहीं हुआ, आपने दे दिया. So इसको कंट्रोल करने के लिए the law has come that a surrogacy cannot, a Haryana patient cannot come to Bhopal for a surrogacy. They have made a very clear cut rule that a patient, that again an intending couple, can only apply to that state where
Hmm.
he has got his residence
Resident.
proof or
Yes.
a job proof.
Hmm.
इन दोनों के अलावा किसी बोर्ड में अप्लाई नहीं कर सकता.
किसी बोर्ड में अप्लाई नहीं कर सकता तो ही इज
या
बाउंडेड विद हाँ दिस
या
इज अ वेरी
अब
बिग
इसके बाद
प्रॉब्लम फॉर
अब
द पेशेंट.
इसके बाद बड़ा अच्छा अमेंडमेंट दैट पेपर PPT में डॉक्टर मोनिका हैज नॉट पुट बट आई शेयर इन वेरी so that says the third part and the last part is that once the state board approves that this intending couple wants this surrogate mother which is fit, that means intending couple name हो गया, एक हो गया surrogate mother. एक बार ये किसी भी स्टेट से तो होगा नहीं, जहां
अपने
एलिजिबिलिटी
स्टेट
होगी,
से.
जहां एलिजिबिलिटी होगी, मतलब तो suppose an IS officer or any government engineer, suppose he belongs to Assam but he is posted at Delhi, so he can apply at Assam also, at Delhi also.
And what
Because
about
उसका
like we have nearby UP people coming to
no
me and
no
they want
नहीं नहीं
surrogacy here, so they have to get a clearance from their board, na?
नहीं what I'm saying, yeah, अब they are asking only one thing, आधार कार्ड आपका जहां का है नहीं है तो आपका जॉब का, because ना job is also important.
Either proof
So
of residence or proof of employment, work.
but the second part
Either
is
of the
very
two, they
beautiful.
can choose
But
two
the
states.
second part is very important, Dr. Jitendra, is that suppose my center, I have chosen a surrogate and an intending couple, and my IVF charges are very high, and the patient thinks that सर के charges तो very high हैं, but हरियाणा में charges IVF के कम हैं, तो the patient is free to choose a treating doctor.
That is his right.
Good.
This is what I felt, that yes, the
I
patient
think
has the right to
yeah.
choose the
So this
center.
will prevent the malpractice.
Extortion, extortion of the patient. And it
Yes.
is valid for 1 year.
Yes. So
Once the
once
board is given, it is valid only for 1 year.
So once the certificate of recommendation comes from the state board and the patient comes to you, yes, everything is clear, that patient can disappear the next day and go to a center of the choice. You know,
Hmm.
that is again the judgment of the patient. So please note, you first of all require certificate of medical indication necessitating gestational surrogacy like MRKH. You require
Yes.
certificate of essentiality for it, intending couple, the age bar and everything. The
Yeah.
eligibility certificate for surrogate mother, again the age, mother of one child, important, and medically fit. Then medical and psychological fitness of surrogate mother has to be assessed by district medical board and appropriate psychologist. Eligibility certificate for intending couple for surrogacy, and then finally the certificate of recommendation from the state board. So these are all the documents which are required. After that, these are the descriptions and the documents that Dr. Randhir talked about. These are just hypothetical cases, 3 embryo transfers. Yeah. Now there is one case where she has undergone one OPU or 2 OPUs. Fresh transfer has been done in one case from a single OPU, and subsequent 2 FET cycles have been done. Will they be counted as 3 IVF failures or not? Here, surrogacy has not happened. This is a PCO patient, severe PCO patient. She undergoes only one OPU. After that, she undergoes 2-3 embryo transfers from the FET derived from the first OPU. Will she clear the surrogacy requirement as multiple IVF failures? Ankita.
2 OPU with 1 fresh
It does come under recurrent implantation failure definition, where more than 3 failures have to be there. More than 3 embryo transfers of good quality embryos. At least 4 of cleavage stage should be there, and 2 of blastocyst stage is there.
So
But
Dr.
here,
Ankita, I will interrupt you here. Dr. Ankita, you did a very hard stimulation for her in Kerala. Send her to Bhopal. I will do a soft stimulation and she will conceive. Is that valid? Softer
No.
stimulation is better in PCO patient. They
Definitely.
made 25 oocytes. They froze all of them, and now they are transferring one by one. Will the quality of the embryos with such hard stimulation be same as soft stimulation? What is the current literature?
Soft stimulation quality will be better, ma'am.
Better. One thing is that. Second, Dr. Ankita, you kept on doing IVF for this patient. Why didn't you think of a donor oocyte? Right? So surrogacy is the last resort. Before surrogacy is thought of, the board has to decide everything. So myself and my colleague who sit in the board, we decide every criteria. FET kitne the, OPU kitne the, what could have been done, what was PGTA done, could the patient afford PGTA, and all those things. And now PGTA has also become affordable. Jatinder, is it right? Now PGTA is not something which is totally out of reach. Okay. There is one woman of MRKH syndrome. She is having a normal sexual life with her husband, but now she applies for surrogacy, and her real sister is ready to surrogate for her, but she is unmarried.
The surrogate should be married.
No, it should be married. You cannot do
Yes.
it.
So again, the
Married
surrogate.
Married with this Monica.
Yeah. So I can make another hypothetical situation that this surrogate, the real sister of this woman, is in a live-in relationship, but she's not married. But still, she cannot become a surrogate.
She
Right?
has to get legally
Right.
married. Yeah, for
So
that.
just
Moreover,
now,
she should have a child,
I don't know. Child
child
is
of her
also
own,
important.
child of her own.
चाइल्ड ऑफ हर ओन वो भी है बिल्कुल
Yes,
सर सही कह रहे हैं एक तो अनमैरिड है लिव इन में रह रही है सेकंड शी नेवर हैड अ चाइल्ड सो
yeah,
बोथ
this is
criteria are negative for this. So again, multiple miscarriages is a definite indication. Now when multiple miscarriages happen at 8 to 10 weeks of gestation and the products of conception have not been tested genetically, now you have got so many methods. You've got microarray, you have got so many next NGS. So do you think that without doing NGS, microarray and karyotyping of partners, you can classify this woman as a woman for having RPL? Dr. Ankita?
Husband have had 5
We
miscarriages.
need documentation to classify, ma'am.
Yes. So there was a time when Jatinder and I, we did our PG, multiple miscarriages, recurrent pregnancy loss was okay. We did our PG in 1990s. But now, Ankita, you are doing your MCH now. Before classifying a couple as a couple with RPL, wouldn't you like to do a genetic test of the product?
Yes, ma'am. Yes, ma'am, definitely. Genetic test of the couple.
Yeah, so this patient can also come under the scanner that you've never had any conceptus tested genetically, karyotyping hua nahi hai. So how can you just apply for surrogacy? Now the surrogacy board, it has become soft when the patient's age is above 45, I have seen. So there are some big cases where we put objection at the age of 43, 44, 45, that was okay. But if the patient's age is above 45, the board automatically says, Are madam, jane do, kyun apan roke? Because she's already 45, 46, she just has 3, 4 years before she can undergo this process. So the board takes a soft attitude. Even if you put scientific reasoning, the board takes a soft attitude. So this is the process flow which is followed in cases of surrogacy by our board in MP. And this is the certificate of recommendation ultimately given by the Secretary Health, who is the member of the state board for ART and surrogacy. And this goes to this particular surrogacy center that you can carry out the surrogacy and on that particular patient. So these are all the copies of the certificate. That brings us nearly to the end of the discussion. We have seen who becomes a surrogate mother, what is the type of insurance cover to be given, why is it important, and even oocyte donor have to be given insurance cover. What is the insurance cover of the oocyte donor?
It is
1
for
year.
12 months.
12
1
months.
months.
Okay. And we have already talked about the number of attempts of surrogacy in one particular woman, the number of. Now, what about MTP? Now, suddenly after
Yes.
being pregnant, 8 weeks of gestation, this surrogate mother said, I don't want the baby. I want an abortion. What are her rights and what are the rights of the intending couple?
She can refuse carrying the baby before the embryo is implanted into her uterus.
Yes. There should then
If,
after.
if for any other
Yeah.
indication her abortion is required, then the board needs to be consulted.
The board needs, and it has to comply with the Medical Termination of Pregnancy Act,
Yes.
the indications, and the intending couple have also to be taken into account, because the surrogate has relinquished all rights to the conceptus as soon as she has become, been transferred the embryo and she's become pregnant. So, we all know the indications of surrogacy. They are very, very clear and very easy to understand, very easy to explain to the patients. That brings us to the end of the panel discussion. If there is any other doubt by the panelists, any other comment by the panelists, you are most welcome. And it's been great discussing this whole issue with you.
I have a
Just
question.
Okay,
Yeah.
Ankita, proceed. You ask your
Um,
question first.
It says in the law that the surrogate, the husband also has to give his signature. Why exactly is that, ma'am?
Which husband of the surrogate?
Surrogate has to give signature.
He has to bear the brunt.
No, I'll tell you. No, this is
Yeah.
because Dr. Ankita, in Hindu Law Act, that once you are married, your uterus ovary is not of your own, because
Anything,
that gamete.
anything. Ardhangini,
Yeah,
your
no, yeah,
Ardhangini,
gamete.
not only
Yeah,
uterus
gamete.
ovary.
Yeah, gamete. That's for medical. So because this is a part of that, so you need a consent. But very good question. Again, a gray zone. Just any PIL or petition the court goes, the favor can be done in the females, because why I'm saying, because आप अगर डिवोर्स में भी जाओगे तो सालों लग जाता है, 5 to 10 years. एंड व्हाई दैट लेडी विल सफर, कि बिकॉज लीगल आप देखिए हमारे पास कितने आते हैं सरोगेसी एंड ऑल, बिकॉज लीगल डिवोर्स इतना इजी नहीं है मिलना.
और सीमेंट डोनेशन में वाइफ के कंसेंट क्यों जरूरी नहीं है हिंदू लॉ के हिसाब से? फिर
सीमेंट डोनेशन
जो
में
सीमेंट डोनर, जो सीमेंट बैंक इकट्ठे वो कर रहे हैं सीमेंट डोनर, वहाँ वाइफ का कंसेंट क्यों जरूरी नहीं है? क्या आदमी के गेमेट
नहीं
में
है,
औरत का
नहीं
अधिकार
नहीं
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 है?
नहीं नहीं, इफ यू आर मैरिड यू हैव टू गिव अ कंसेंट, व्हाई नॉट गिव?
सीमेंट डोनेशन में कहाँ, एआरटी बैंक में वाइफ का कंसेंट कहाँ लगता
नहीं,
है?
हम तो लेते हैं, आई
नहीं,
टेक
पर
आई टेक.
वैसे लगता नहीं है, लॉ में नहीं लग रहा हमारे.
नहीं, इसलिए तो क्वेश्चन गुड क्वेश्चन है ना. लॉ
मेल
में नहीं लग रहा है
डोमिनेटेड
तो फिर
सोसाइटी है ना, यूट्रस ओवरीज तो तुम्हारे हैं, पर स्पर्म देते टाइम तुम
No,
पैसे लेके
but
स्पर्म दो.
Ankita
चलो.
has given a very good question. Now, the straightforward question is that you have a very perfect question, because I think if you are married, the other partner has a right to whether you can distribute or not.
What I feel was, yes, there was certain things which were going wrong in under surrogacy in India, which have been taken care of by the law. But are we not denying somebody's basic rights? Like if a male person wants, he's alone. He's not getting any wife. He's not getting married, or he has lost his wife. Why can't he bore a child through surrogacy? I don't know why this question is there, that a lady, single lady, can still go in, but not a male person. He can. He's rich enough. He can keep some maid. He can
This
take
is
care of the
just
child.
because of the child abuse. Jatinder, nothing else.
The child abuse.
The
Yeah.
rate of child abuse and POXO
By
has
males.
scared
Yeah.
everyone so much. The ethics of people have gone so down
Low. Yeah.
that like government doesn't want to give rise to crime now. You know? So
But
that is the
it
But we are
doesn't mean that.
somewhere hampering the basic right of a human being, basically, to borrow.
But Dr. Jitinder, I support you. If you go to the court, Supreme Court and all, human rights में Article 21 में you'll win. You will win. क्या मैंने कहा नहीं, ये बिल्कुल लीगल, बहुत जल्दबाजी में बनाया गया है, बहुत भय में बनाया गया है, डर में बनाया गया है
डर में
act.
बनाया। बिल्कुल सही है।
So coming back to the last part of the slides, a few lawyers, especially budding lawyers, this is some Sakshi Institute of Law, Kurukshetra University. She has given controversial viewpoints about this act, that this act has well tried to deal with issues positively, but the on-ground realities are different. And really, we think it is altruistic, but कुछ ना कुछ इधर उधर का सौदा हो रहा होगा, whether अभी होगा या 5 साल बाद होगा या 10 साल बाद होगा. So, altruistic surrogacy has ultimately proved a failed idea in European countries. And so, in India also, the scope should be extended in such a way in the future to allow regulated commercial surrogacy so that both economic help as well as love of the child to respective genuine deprived couple can be ensured. Because earlier, because it's a fact that people who are doing surrogacy, some centers which are doing, I mean, no comments, but it's not all altruistic. Only one thing which can be said is this. So thank you all very much for this
Thank you
interesting
so much,
discussion.
Monica.
And I
Thank you,
just
Dr. Monica. Thank you, Dr.
thank you
Randeep.
so much
Thank
for
you very much.
accepting my
Thank you, all the
Thank
panel.
you everyone, sir. Thank you for very good input.
Really,
And
we enjoyed it too much.
again, in the last part of the webinar, I always say that ये act जल्दी में आया है और हर चीज के लिए ग्रे जोन है, because I share with one just talk that एक 51 ईयर की लेडी आई, उसके 2 बच्चे थे, दोनों एक्सीडेंट में मर गए. अब उसको she cannot go for IVF, एक डोनेशन भी नहीं जा सकती. तो ऐसे जो सिनेरियोज हैं, that should be apart, allowed.
बस वो है कि वो बच्चे पैदा करेगी, तो मान लो आफ्टर 2 साल में उसको हार्ट अटैक हो गया, तो बच्चों का क्या
नहीं
बनेगा?
देखो
ये
डॉक्टर
सब चीजें
जतिंदर, देखो
इसलिए एज क्राइटेरिया रखा है, बट यस मतलब एंड अब वो कुछ
नहीं
यू
देखिए,
कांट चेंज योर
हाँ
डेस्टिनी, मतलब बट
हाँ
इट इज कम इन। आई आल्सो एग्री, सरोगेसी में लोगों ने मतलब रूम्स बना के सरोगेट को ताले लगा के रखने शुरू किया हुआ था, दिल्ली में, अहमदाबाद में, और पता नहीं फ्यू प्लेसेस। तो वो भी तो एक टॉर्चर था, उनको फैमिली से बिहार वगैरह से ला के उनको 1-1 साल जेल खाने में डाल के रखना, वो एक गलत तरीका था ना फिर। तो डॉक्टर्स भी बिल्कुल एक्सट्रीम पे पहुंच जाते हैं। तो
देखिए, वो तो देखो ब्लैक
इसलिए
शिप
लॉ
तो हर
होना
जगह
जरूरी है।
पीसीपीएनडीटी नहीं, लॉ बना है, लेकिन इसमें हमारा देखिए, ये गवर्नमेंट का
लेकिन
काम है चेक
ड्रैकोनियन लॉ
करना.
है ना, 10 लाख की
हाँ,
पेनल्टी, 10 साल की जेल। अरे कुछ आप थोड़ा सा मतलब उसको लीनियंट रख के, लेकिन लॉज को प्रॉपरली रख सकते थे, है ना,
बट
थोड़ा सा
डॉक्टर
ज्यादा
जितेंद्र, ये
स्ट्रिक्ट
देखिए,
रखा।
2-3 साल हो गया, 3 साल हमारे सरोगेसी सेंटर्स को रिन्यूअल का डेट आ गया, बट मुझे लगता नहीं कि आज तक ये जो किसी को पेनाल्टी हुई है, नहीं हुई है ना.
चलो, नहीं हो अभी तक, उनको समझ नहीं आ रहा, जब समझ आएगा तो करने भी लग जाएंगे।
नहीं
पीएनडीटी
लोग
भी तो
कर रहे
ऐसे ही
हैं.
था, फॉर्म एफ में एक लाइन के लिए बेचारे रेडियोलॉजिस्ट पुणे के 10-10 साल से अंदर पड़े हैं, बताओ।
नहीं लेकिन अभी भी तो कर रहे हैं ना, ब्लैक शिप्स तो है ना, अभी भी आपको चल रहा है ना, द पीपल आर गोइंग इन द
वो
मेनी
वी डोंट
सिटीज.
नो, अभी तो मेरे को लगता हरियाणा में तो अभी बेचारे शुरू ही नहीं हुए शायद।
नहीं, आई एम टॉकिंग अबाउट द सेक्स डिटर्मिनेशन पीसीपीडीटी. तो ऐसा तो नहीं है कि पीसीपीडीटी
अच्छा।
आए हुए उसके बाद नहीं हुआ. तो आई थिंक लॉ हैज कम फॉर दैट.
Jatinder, I
हाँ
wanted to ask you a question
हाँ,
pertaining
आ जाओ मनीषा जी.
not to this webinar, but to the Haryana as a state. Haryana has got some of the biggest female athletes. And the girls over there are so strong, such great personalities,
बहुत
sportsmen,
ज्यादा हाँ
fighters, wrestlers. तो
हम्म।
how come fetal वो female infanticide वहां शुरू कैसे हुआ? मतलब वहां सेक्स डिटर्मिनेशन जो सेक्स
एक
रेशियो था, why
एक
did it get
एक एक
disturbed?
ना मानसिक वो है स्तर है सोचने का, वो एक पब्लिक फोरम पे आई कांट डिस्कस अबाउट
Okay,
द
but still
रिलीजियस एंड द
but
थिंग्स,
just as
बट
a
आई कैन
state, that this state has produced some of the biggest female athletes and
यू सी
wrestlers.
अ फीमेल हरियाणवी गर्ल को देखो, इतनी कॉन्फिडेंट होंगे, दे आर सो ब्रिलियंट इन देयर आईक्यूज एंड एवरीथिंग, तो है वो सो है कि थॉट प्रोसेस है
But that
सोच
female athlete, when she grows up, she will want a son.
नहीं ऐसा नहीं है,
वही है।
ऐसा
बहुत
नहीं
चेंज
है.
हो गया। आई हैव
Okay.
हैड मतलब फॉर द लास्ट वही आई हैड अ डॉक्यूमेंट्री बीइंग मेड हियर, तो इट इज दो पर्सन पीपल हु हैड दैट बिल्कुल ऑर्थोडॉक्स सोच ना, वो मतलब पहले बहुत थे, अब वो श्रिंक हो गया वो।
Think,
Now
okay.
I have patients who have a third female child and we have a big party in the hospital. They're celebrating by themselves. So
Chalo,
it is
good.
how the mindset is being changing, because they have now they now understand that females care for them better in the old age, and they are now financially sound also, and they're going abroad, they are achieving higher positions in administration and all. तो बहुत सोच चेंज हुई है मेरे, मतलब देखते देखते it's almost 28 years, तो मतलब बहुत सोच चेंज हुई है,
Yes. And
बहुत
Ankita,
फर्क
what
पड़ा है
is the
मतलब।
situation in Kerala? What is the situation in Kerala as far as surrogacy is concerned?
Well, not all centers are started yet. Only one or two centers are doing it.
And
So it's
Moshmi
still
ma'am,
not
Bengal?
started yet.
Bengal, Moshmi ma'am? Vinita ma'am, Rajasthan?
There are not much centers who are giving the services regarding surrogacy.
Acha, Punjab mein sir, Sanjeev sir?
Same here.
Yes, it is going on in Chandigarh.
Okay, okay.
Not that at high number, but it is going without any much complication.
Okay.
Yes, but I tell you one thing. There is an oncosurgeon in Kolkata. Uh, he is I mean, single father, and he has a twin pregnancy through surrogate. Perhaps before all these laws came out. Yeah, and he is very nicely rearing them up.
Yes.
Right. So this another thing, sometimes I think, will there be any law for the LGBTQs? I
Yeah.
don't know.
Yeah, we all
Yeah.
remember that picture where the two Israeli couple, two
हम्म
men had come and taken a surrogate baby from Anand. I think Naina ma'am ne kiya tha. Nahi, Gautam Allahabadiya, somebody had done. I don't know.
हम्म।
So, I mean, this is also, they are also human beings.
Yeah,
LGBTQ
right.
plus A community are
We
human
can talk about rights of dogs here in India, but we cannot talk about human beings.
beings.
नहीं नहीं
Yes,
नहीं, बट डॉक्टर जितेंद्र देखिए, लॉ है, देखिए लॉ में क्या
मतलब
है
उसको
कि
उसके ऊपर बुद्धिजीवियों को देखो, कोई भी कानून बनने से पहले बुद्धिजीवियों को बिठा के डिस्कशंस होने चाहिए, उसके प्रोज एंड कॉन्स डिस्कस होने चाहिए, फिर एक लॉ आना चाहिए। अब डाउरी एक्ट लगा दिया, मतलब आई विजिट द जेल्स यार, अच्छे अच्छे फैमिलीज के लेडीज और बेटियां बेचारी अनमेरिड कॉलेज से उठा उठा के ठूस रखी हैं जेल में, जिन्होंने कभी डाउरी नहीं लिया, वो लोग भी। मतलब एक लॉ बनाओ तो कम से कम उससे पहले सोचो तो सही, एक कानून बनाओ तो सोचो तो सही, इसका इम्पैक्ट के ऊपर डिस्कशन कम से कम मेरे को लगता है 100 डिस्कशंस तो हो, जिसको रिकॉर्ड किया जाए, जिसको सुना जाए, और
अरे
फिर
अरे
कानून बने।
डॉक्टर जितेंद्र, अभी जो 304 है, हम लोग अभी नेशनल बॉडी पे लड़ रहे हैं, एसोसिएशन आई एम एंड ऑल। जो 304 ए था पहला अपना, जो
हाँ
क्रिमिनल केस लगता था, अब उसको जो न्याय संहिता बना दिया डॉक्टर अमित शाह ने अपने, मतलब अमित शाह जी ने, गृह मंत्री ने, उसमें बहुत ही वो कर दिया है 304 ए को, बहुत ही वो हम लोग फंस गए हैं डॉक्टर्स, तभी हम लोग सुप्रीम कोर्ट में जा रहे हैं। तो
हाँ,
दैट इज वेरी इंपॉर्टेंट। तो हम लोग को
मतलब
लड़ाई
हमें
लड़ना
और
पड़ेगा,
इट इज नॉट एन
तभी काम
इजी
होगा।
थिंग, सुप्रीम कोर्ट इज नॉट एन इजी थिंग। आप आईवीएफ में सरोगेसी में कमाते हो, लॉ करते हो, तो वहां पे आपके सुप्रीम कोर्ट के लॉयर्स बैठ के जो एक्सटॉर्शन कर रहे हैं लोगों का, वो क्या है?
अरे
इज
भाई,
द
उनकी
इज
फीस
इज द जुडिशरी ब्लाइंड? इज द
25 लाख
जुडिशरी
50 लाख
ब्लाइंड
पर हियरिंग
अबाउट
की
इट?
है फीस। तो
है
एक आधे घंटे की हियरिंग की 25-50 लाख फीस है उनकी, मालूम है आपको?
फिर क्या है, ये क्या है? दिस इज ऑल्सो एक्सटॉर्शन। ये इसको सियो मोटो कॉग्निसेंस में नहीं ले सकते, वो ले सकते हैं ना
अब
जजेस।
अब होगा, ऐसी क्रांतियां आएंगी डॉक्टर जितेंद्र, जैसे मोनिका ने
हाँ
कहा था कि यू आर
हाँ,
क्रांतिवीर, तो आप दिल्ली के पास हो, हम थोड़ा दिल्ली के दूर हैं, क्रांति स्टार्ट करिए, हम तो साथ हैं आपके।
नहीं,
जब भी कुछ
Jatinder,
लिखती हूँ बोलती
always,
हूँ, तो चार
always
पांच लॉयर्स मुझे कहते हैं कि यू कैन नॉट राइट अबाउट सुप्रीम कोर्ट, यू डोंट स्पीक ऑन पब्लिक फोरम अबाउट सुप्रीम कोर्ट, नहीं तो आपको अंदर कर देंगे, बताओ। दिस इज
नहीं देखो देखो, हम सुप्रीम कोर्ट को ये नहीं बोल रहे, हम ये बोल रहे हैं कि जो लॉ बना है, एक्ट बना है, लॉ एक्ट सुप्रीम कोर्ट
ऐसे
इज नॉट
बहुत सारे
अबव।
एक्ट हैं, बहुत सारे एक्ट
हाँ
हैं जो जिनको बिना सोचे समझे ऐसा लगता है कि ब्लाइंड फोल्ड होके बना दिया गया है।
नहीं नहीं,
मतलब
इसीलिए
कुछ
देखो, इसीलिए तो क्या है कि जो आपका कॉन्स्टिट्यूशन है, इंडियन कॉन्स्टिट्यूशन के ऊपर कुछ नहीं है, तो
नहीं
राइट जो है, ह्यूमन राइट, दैट इज इम्पोर्टेंट।
चलिए,
That is
thank
very,
you.
very
I think
important.
the discussion will go
चलो,
on and on. It is
हाँ,
nice.
एक बार हम तीनों बैठ जाएंगे, all the three Bhopalis will sit.
Yeah.
And everyone will now be going for dinner. So thank you so much, Moshmi ma'am, Vinita ma'am, Jatinder, Ankita, dear Ankita, Sanjeev sir, Simmi madam,
Thank you.
and Aswati. Pata nahi, Aswati
It
did not
was
join
very
us.
enlightening, Monica. I learned very nice points, and thank you so much, because I had a patient and I gave this link to my board member also, that they should see,
Yeah,
and
please.
they
And
wanted to learn, है
yeah,
ना?
if this webinar wants to be watched by anybody, then I will share the YouTube link. You can go to my channel, and all the webinars are there in the YouTube. So thank you so much, Team BSV, our
Thank you,
medical
Dr. Monica.
advisor. Thank you, Moshmi ma'am. Thank you,
Thank you,
Anmol.
ma'am. Thank you,
Okay,
ma'am.
okay, bye. Good night to
Thank
all.
you, madam.
Bye, bye,
Thank you
bye,
very
bye,
much.
bye.
Good night.
Our
Bye, bye, bye.
perfection
Okay.
8.0 is between 15 to 20 of December, before the Christmas vacation starts. So we will have another session before the new year starts, 2026.
Okay.
Thank you.
Thank
Thank
you,
you so much.
Thank you, ma'am.
thank you,
Good night.
thank you,
Bye.
thank you,
Thank you, madam.
Bye.